कॉलेज ऑफ भावनगर, and I must thank all the participants. कि हम सब लोग आ जाएंगे और आप नहीं आओगे तो program is not possible. So thank you everyone, and I assure you that at the end of today you all will be happy that you have a real sense academic feast. Again, thank you very much. Jai Jai Garvi Gujarat, Bharat Mata ki Jai.
Thank you so much, sir. Now we will request our Dean Sir, Dr. Chinmay sir, to felicitate Dr. Avinash Suri, sir.
Now I would request Dr. Amit Parmar sir, our additional Dean sir, to felicitate Dr. Suchita Dandekar ma'am. Now I would request Dr. Sunil Panchwani sir, HOD Medicine Department, to felicitate Dr. Naresh Kumar Jain sir.
Now I request Dr. Balani sir to felicitate Dr. Praveen Singh sir. Now I request Dr. Panna ma'am to felicitate Dr. Suman Singh ma'am. Now I request Dr. Jayesh sir to felicitate Dr. Neeraj Mahajan sir. Now I request Dr. Kerwin ma'am to felicitate Dr. Chitna ma'am. I request Dr. Ghanshyam sir to felicitate Dr. Nandini ma'am. I request Dr. Samir Shah sir to felicitate Dr. Swapnil sir. Now I request Dr. Seema ma'am to felicitate Dr. Pankajakshi ma'am, Principal of Dental College and Hospital. Now I request Dr. Harsh sir to felicitate Dr. Shreya Trivedi ma'am, Principal of Sri Sahajanand Institute of Physiotherapy. Now I request Dinesh Gurgama sir to felicitate Dr. Preeti Muni ma'am, Principal of Homeopathy.
Now we would request Dr. Suchita Dandekar ma'am, President of AHP, to say a few words.
Good morning, everyone. Thank you to all the people on the dais and off the dais for being here on a Sunday morning. I hope all of you participated in the yoga because it is International Yoga Day. If not, at least go home and do some yoga today. AHPE is the Academy of Health Professions Educators. And it began with just a small group of us thinking that education is for all. It's not just the medical side, but it is for all health professions to come together under one single wing. And that is what all of us are here for. This particular midterm, I would like to maybe call it a chapter conference also, because it is very unique and it is the first time that AHP has decided to have a chapter conference. So kudos to Dr. Chinmay Shah, who has been able to not only do, he always has many firsts to his credit, incidentally. He also, along with Dr. Supre, was the first people who did an AHPA virtual workshop for us. So, and then this is the first time that we also have a chapter conference of the AHP. And I'm also very thankful that all this happened when I became the president. So thank you for letting me hold your hand and taking this whole AHP forward. All of you here also play a very important role because it is only participation from all of you from what we learn from you and what we are able to offer from the years of experience that we've had that will take HPE, the health professions education, forward. I was so happy and touched to see the dental, the homeopathy, and all the other deans come here because we are all here having the same one idea in mind of being able to educate everyone in healthcare together. So with that, I would like to say thank you very much. And I hope all of us enjoy ourselves in this one day of deliberations that are going to happen today at TMC Bhavnagar. So thank you very much.
Thank you, ma'am. Now I request Dr. Avinash Sukhe sir to say a few words.
Respected Dean Sir, the President of the AHPD, Dr. Suchita Dandekar, all the people on the dais, Vice Chancellor Sir, all my colleague faculty members, the senior principals, the friends, and of course my great friend Dr. Sanjay Bedi, who is online. I think you all realize that this is a landmark kind of an event where we are doing first time a midterm chapter conference in AHP, which I feel I really thank Dr. Chinmay Shah and his whole team for doing it so nicely. Thank you so much, Chinmay, for such a wonderful thing. Now, I think why health professional education is so important, because I'm going to tell you one small story. You know, I think the fact that something education is drastically changing. You know, AI has changed the whole education. And what really, but AI we think is the whole solution is AI today. That's what many people think. But I'm going to tell you one story. There was one fellow and there was one frog. So he said, let us experiment. So he cut one limb of the frog and said, you AI had asked him to jump. So the frog jumped. Then he cut the first before all front limbs, and that also he cut. And that AI said frog jump, so he also jumped. Then he cut the third limb. Then also the frog jumped. And then he cut all the four limbs. The frog did not jump. So the AI concluded that the frog cannot jump because he is deaf. Now the problem is, today AI can bring conclusions which are of no sometimes relevance to us. Sometimes it is really on the dot, sometimes it can bring all kinds of conclusions. Now in this world, people are really confused when to really use AI and how to use AI and how the digital literacy, the newer methods are changing. And the most important thing which remains is a faculty development. Our faculty and students need to continuously develop themselves in this world. And that is the reason why there is a need for HP, need for such workshops. I think therefore I feel conducting these workshops to the varied faculty is so important today. And I think this is what Dr. Chinmay has been able to achieve. And we really thank him for his wonderful coordination and the way he has really done it. Thank you so much.
Thank you very much, sir. Now I would request Dr. Sunil Panchwani, sir, to say a word of thanks.
Morning all. I am happy to see the auditorium is almost full, though this is a faculty development program. Let me thank all the dignitaries on the dais, Dr. Avinash Supe sir, Dr. Sucheta Dandekar madam, and AHP for conducting the first midterm AHP over here. Dr. Naresh Jain sir, the Vice Chancellor of Ayurveda University, all the dignitary speakers, Dr. Praveen Singh sir, Dr. Suman Singh madam, Dr. Chetna Desai, Dr. Nandini Desai madam, Dr. Neeraj Mahajan sir, and Dr. Swapnil Parelikar sir. Let me thank my college dignitaries, our dynamic dean Dr. Chinmay Shah sir, dynamic additional dean Dr. Amit Parmar sir, Dr. Ashok Wala sir, medical superintendent, who were they helped us to conduct this meeting. I am also thankful to the whole committee guided by Dr. Kailash Bhalani sir. I am also thankful to the auditorium karamcharis and the kitchen karamcharis. Thank you thank you all, and not to forget all the participants. Let me thank Dean Dental College, Dean Homeopathy College, Dean Ayurvedic College, and Principal Nursing College, and all the participants. Thank you for coming to this FTP, and you will learn a few things from this FTP. Thank you very much.
So before we conclude, just would like to say that as you all know that we have 5 workshops. So the workshop of OSPE will be the microbiology department, workshop of MCQs in pathology department, workshop of SGD and STL is in the PSM department. The students workshop is in our so-called council hall, and online workshop on AI will be in the 2 places, because we have more than our expected participants offline and online. So Reddy sir, thanks to you especially, because before 2 days only I have informed you that I am going to take the workshop, and you have agreed for that. So we have 2 places. One is a e-learning lab. So those who don't have a laptop with them, go to the e-learning lab, and those who have brought the laptop, we request them to go to the Manan Hall near the Dean office, and we will start the session. Thank you very much. Thank you one and all. So now we can move to our respective places. And after lunch, we'll be coming back here for a plenary session. We have a wonderful session by Dr. Supe sir, Dr. Dandekar madam, and the focus of low-cost mannequin competition. So we will, post that we are gathering here only. Thank you all.
A gentle reminder, those who are yet left to fill up the pre-CME questionnaire can scan the QR code displayed on the screen and fill up the pre-CME questionnaire.
ना बताओ
Mm, 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 four, one. Should I share screen?
Yes, sir. You can share the screen, sir.
Okay. Just let me know when I should start.
Sir, we can start in 5 minutes.
Okay.
Okay, thank you.
हाँ मैं अच्छा so friends, I think we can start now.
You can start now, sir.
ना ना ये तो चेक करेलो सर
This meeting is being recorded.
Should I start?
Yes, sir, we can start now.
Okay, thank you.
Thank you, sir.
So, friends, please go to menti.com and put in this code or just scan this QR code. This will be a short questionnaire to assess your previous knowledge, and then we will move forwards. And also we will just learning by assessment, we will also learn something through this questionnaire. So to begin with, how many of you agree that India will become hospital for the planet by 2030? India is already the pharmacy of the planet, and the speed at which our healthcare sector is growing, we have got 600 medical colleges, or rather 800 now, and over a lakh of students are being produced every year. So, and the cost of healthcare is increasing in the rest of the planet. So we have to just time is not far when we will be having already people are coming from all over the world, medical tourism hub of the world. I can see in coming few years. So the first question, what describes an AI agent? What is your you previously think? Yes. Now there was a time when we had computers, we had artificial intelligence to which we used to ask questions. And that was all, and it used to give us 7, 8 links, and we had to read it, uh, all of them, and decide which one is good, etc., etc. But now, with the system has moved when based on the data, it autonomously takes some decisions. And for example, the patient comes, the patient's history is already there, and automatically the agent transfers the patient towards the OPD where he or she has to go. The previous tests are automatically brought out from the system, and they come up on the doctor's screen. All these agents, they are now available. Yes, scheduling follow-up reminders out of these options. Uh, we all have such softwares, Practo, which send automatic reminders to patients the day that time comes. You can write on your screen. Correct answer is agent. Artificial intelligence is something agentic. When artificial intelligence starts working on its own, Okay, so this was some basic questions. There are some more questions which we will take up later on. Okay, now let me, we are all living in an era where computers have entered our life quite a lot. Rather, they are the part and parcel of our life at every stage. So I'll begin with a brief history how we have come to this. I hope you all know when. I'll just stop sharing for a moment and uh, when we were all in school, we used to we studied binary arithmetic 0 1 0 1 1 1 0 0, and in the world of current it is either the current is on, the wire is connected or not connected. So if not connected, it becomes 0. If connected, it becomes 1. And if we had a 0 0 0, we used to call it A. Another set of wires we used to call it B, and it became an international code that if there are 8 wires and they are connected in a particular sequence, it represents a particular uh, word. I mean, alphabet A, B, C, etc. And this is how the original computers they evolved. And ultimately, then from 8, it became 32, and then 64, and then 128. So the permutation combinations, they kept on increasing, and they brought in colors, they brought in millions of, they brought in different languages, Unicode. So all this happened. Then as computers, the speed went on increasing and the number of possibilities also increased. Then they said if we can make a particular code for A, B, or C, we can, or a color, we can also make it for a particular word. The English dictionary has got about 1.25 lakh words. That's all. So they gave a code started giving code to particular word. And as that code increased, so in just 1.25 lakh words, they gave them code, and we had a code for every word. And then they brought these, whatever the combinations are possible, they started making sentences. And this got applied to all the languages on the planet. And once this was done, the speed of computers increased, and this formed the basis of artificial intelligence. The basic principle is still the original zeros and ones, and as the speed of computers is increasing, we are moving towards better uh, possibilities. So as we move forwards, we are now witnessing a fundamental shift how AI is helping it is in our day-to-day work, and it is no longer a search engine or from where you can put in a question, but it is an active partner in clinical reasoning. And also, we move from passive information technology to active information technology, where it is collaborating with the doctor, and the AI, it becomes a tool for cognitive partnership. I mean, we have now reached a time when there are something known as agents, and agents are autonomous systems which represent the next paradigm of AI. How many of you are already aware of Chat GPT or Perplexity or Claude? Just write Y in the chat box. Yes. Yes, I can see a lot of yeses. I don't see a single no. So I can assume that all of you already know something about artificial intelligence or Chat GPT, and so now this is the next level. The gradually there is we had the artificial intelligence 1.0 where it was rule based. Okay, we press this button and this is what happens. Then there were pattern recognitions. If there was a cat uh, or a particular diagnosis and thousands of such diagnoses were shown to the machine, it easily said that this is the diagnosis of this particular image. Or it could be anything, a person, face recognition, or ultrasound machines, or even X-ray machines, but histopathology slides, or even the patient histories. So, what is an agent and what makes it agentic? The agents possess certain distinct capabilities which they have got a built-in, billions of computers are connected behind them in the form of a large language model, and it brings together all the data from different computers, millions of computers, other petabytes of computers, and there is self-directed learning. It plans and then does multi-step tasks. We will just show you some hands-on in a few minutes. And there is a dynamic adaptability. And in case of, I think these days, almost all medical students, starting from first year, they all know what is artificial intelligence. They all know ChatGPT. I mean, it is a compulsory subject from sixth standard on. In some places, even third standard students, they use AI-based softwares, and in 7th, 8th, 9th, 10th, CBSE has made it compulsory. And once this population of students who have studied it in very early school days, once they reach the medical colleges in 12th, you will see that they are already in touch and they will have some they will use it more creatively. And as teachers, we have to be ready for it. So there is personalized learning, there is clinical simulation, there are feedback loops, and also there is a real-time feedback. So we will start with the prompting, which is the future of education, in which we give a particular tool. I mean, we give certain context that, okay, this is what we are, this is the patient profile. We give it a role that, okay, you are a pathologist, you are a physiologist, you are a medicine specialist, you are a surgeon, etc., etc. And then we give, once this persona is given, then a task is given, and according to it, there are definite exact reasoning outputs and stepwise diagnosis and teaching explanation. And then that is done again and again, repeatedly, and it gives reasoning tasks. Now I go hands-on. Open ChatGPT on your computers. We will just show you some uh, live. We will do some activities on ChatGPT. The different types of prompts. Now, one thing I just want to tell you, there are many agents which are built in ChatGPT also. So if you just press slash, you can see a number of just by pressing slash, there is something known as study and learn. Now this is an agent for students. Supposing the student wants to learn any topic, you can use any topic on your screen. I'll just put in inflammation. For pathology student. So it has given me some information. A patient who cuts a finger, within a few hours, the area becomes red warm. Do you know the classical name given to these four signs? And cardinal signs. Correct. As a hint. So, can you recall the 5 classical cardinal signs and their Latin names? So, this way it will keep on asking questions. And you also try this with any topic of your own choice on your screen. First, start the study mode.
Excuse me, sir. Sir.
To start the study mode, you have to just type // and then it will give 4 types of options, and study and learn is one option.
Excuse me, sir. Am I audible?
Yes.
Sir, and the script is not very well visible. Can you turn your laptop setting into light mode, please? Is it possible? Because the text is not visible. Or you can increase the zoom of the browser.
Okay.
Oh, okay. Thank you, sir. Thank you.
It is not visible. You are not on laptop. I am trying. Let me see.
We all are on MEU e-learning lab.
Yes, I have doubled it.
Now it is fine, sir. Now fine, sir.
Yes.
Okay. Thank you.
So you just click on / and you can see these 4 options. So click on study and learn, and it will turn into a teaching machine for student, in which it will teach and it will also ask questions. You can give it any topic, rarest topic. For example, I gave it, say, for a clinical person, Hodgkin's lymphoma. So it will ask me start, what is the name characteristic of the classical Hodgkin lymphoma? Reed Sternberg cell. So this way you can just convert it into a teaching machine. Now let's do one more thing. Now there are different types of prompts, and the first type of prompt is called zero shot prompting. Create a 5-question quiz on cardiac auscultation for 3rd year clinical students. And I can also make a scenario based quiz. In which I want 5 questions. This is a straightforward, it's called zero shot prompting. And I press this. So it is giving me a case, and also it has created 5 questions which I can study, and I have given it a straightforward question. It's called, and there is an answer key also. And there are reflection questions also. And this way the student can learn. So you all try zero shot prompting on your screen on any question. You have 30 seconds. After that, I will go to the next one. The next one is one shot prompting. A 45-year male presents with polyuria, polydipsia, and 15-pound weight loss over 2 months. Vitals are stable, blood glucose 320, and dry mucous membrane. You give it the patient's case sheet and some more data. And it will provide you with a SOAP note. SOAP means subjective. It will convert it into the history of present illness, the vital signs, physical examination, assessment, and the plan of medication, what to do, and then also create. This is called a SOAP note. So the benefits of this is that it helps maintain consistency in clinical documentation, standardizes the case presentations, and ensures proper formatting. And you have to create a high quality example that represents expected output and then ask the AI to produce a similar content. This helps in teaching documentation standards and demonstrating proper case presentations and illustrating correct abstract formatting and modeling. Next, we come to few shot prompting. These are different types of prompts which are universal. they can be applied in anything, whether it is medicine or engineering, or I mean, there are certain rules in any branch. So a 67-year female presents with high onset chest pain radiating to left arm associated with diaphoresis. Here we are giving it 2 or 3 examples, and we have asked it to generate. It will create a similar clinical vignette according to. So supposing we are in a ward and we have got multiple patients data, and it will create similar patients based on 3 or 4 or 5 or 100 or 200 examples. Now you see, we all have ABHA IDs for, in 2-3 years we will have ABHA IDs for 1.4 billion people, and that will give us one of the best possibilities. So it is very important that all of us learn prompt engineering and start using it in our day-to-day life. Next is chain of thought prompting. Chain of thought means think step by step. How would you differentiate bacterial versus viral meningitis clinically? Consider history, physical examination, findings, laboratory values, and additional tests. Explain your reasoning at each step. Now, this is called chain of thought prompting. So it is giving history, physical examination, CSF findings, blood tests, additional tests, conclusion. So this way, whatever the patient's history is, we can just give it, and then it will help us. It will serve as our supporting system. I hope you are, I'm not going too fast.
Good morning, sir.
Yes.
Sir, like when we have to write a prompt, we have to write this word first, chain of thought.
No need. But if you can write, this is because for you people, I am typing it for you people to understand. It will automatically take. Here I will remove tree of thought prompting. List 3 possible diagnoses for a patient presenting with jaundice. Explain the pathophysiology and distinguishing features of each briefly, and select the most likely diagnosis based on these 3 additional findings: fever, right upper quadrant pain, and recent history of gallstones. So this is, I have given it a tree of thought. The first level, second level, third level, and then I press. So first it will generate 3 possible causes of jaundice. Then it will come up with the additional clues: fever, upper quadrant pain, and you will see which diagnosis is most strongly diagnosis, and then it will. Now if I remove the study part here and ask it again, see what it does. Now it will give me even more. The Charcot's triad, carcinoma head of pancreas, distinguishing feature, most likely diagnosis, expected investigations, clinical importance, most likely diagnosis, ascending cholangitis. You can take any patient and you put the patient's history, you scan its investigations. These days, most of the investigations are available on PDF, and you can even put in MRI scan and ultrasound and put it all together and ask it to give me the differential diagnosis of this patient. And you will get a beautiful differential diagnosis along with the further course of action. But remember, it is correct about 98 or 99% of the time. You have to learn it yourself. I mean, it will not be that it is your supporter. It is not your replacement. 1 or 2%, there is still, there is there can be hallucination or mistake. But as time is passing, the all these hallucinations are disappearing. And I think in another 1 or 2 years, especially if you have Claude, which is though it is paid, but it gives a very, very good response. And
thank you.
Next, I come to a role prompting. Role prompting means that I give it a role. You are a pathology professor teaching second year medical students. Explain the classification of anemia based on red cell morphology, include key microscopic findings associated with certain conditions of each type and typical laboratory values. Use language appropriate for students who have complete basic hematology but had no clinical exposure yet. I have removed the learning general one. So let's see what happens. Classification of anemia based on red cell morphology. Microcytic hypochromic anemia. Peripheral blood findings, common causes, thalassemia, memory aid, normocytic normochromic anemia, macrocytic anemia. This is role prompting. If I say, just see, I'll paste it again and I'll change the role. Instead of pathology prompting, I'll say I am a I'm a medicine professor or surgery professor. And teaching third year final year students. And here, let's see, I have what it does. I will have to change the prompt because I have called it. The detail is less. And it is talking about gastrectomy, bariatric surgery, or all the points which are relevant to a surgeon. And key viva points in which those questions which are relevant to a surgeon. So now we will talk about a new method, co-star prompting. Now it already knows the co-star model. The co-star model involves the context, objectives, strategies, the teaching, assessment, and reflection. I'll repeat, COSTAR stands for context, objectives, strategies, teaching techniques, assessment, and reflection. So now I will reflect on a teaching session about cardiac auscultation for medical students. The observation, the context observation, self-awareness, thinking, action, results. It has used its own vocabulary, but it is the meaning is the same. Then there is something known as pico prompting. Pico is same as we use in our research, the population intervention, context, and observations. Create a properly formulated PICO questionnaire to compare the effectiveness of cognitive behavioral therapy versus SRI in depression in adolescents with remission. I mean, this is how we create a research question. Then suggest appropriate search terms for each PICO element and explain which study design would best answer this question.
Sir, there is one concern we have. सबके पास पेड वर्जन नहीं है, तो सबके चैट का जो टाइमिंग और जो फ्री चैट का जो भी होता है कूपन्स वो खत्म हो गए.
Your voice is not क्लियर?
सर आपके पास पेड वर्जन है, बाकी लोगों के पास पेड वर्जन नहीं है, तो वो जो क्वेश्चंस कर नहीं सकते अब चैट जीपीटी में।
चलो आप फिर देख लें। तो इसका तरीका होता है कि भाई आप परप्लेक्सिटी आजकल फ्री है, यू कैन यूज परप्लेक्सिटी। परप्लेक्सिटी भी फ्री है, और नोटबुक एलएम वो भी दिखा देते हैं, बिकॉज जो फॉर स्टूडेंट्स इट इज फ्री, पर आपको वो यूज करना पड़ेगा। आइडियली आपको एटलीस्ट एक एलएलएम पेड वर्जन ले लेना चाहिए। वो ज्यादा महंगा नहीं है, 340 रुपीज पर मंथ में ये इसका फ्री वर्जन मिल जाता है। सो इट हैज क्रिएटेड, और आइडियली तो अगर कॉलेज भी दे दे तो ठीक, एक डिपार्टमेंट को एक कनेक्शन दे दे तो वो भी ठीक है। So this is how it has created the entire PICO question आया। So हम we will continue there, अभी 5-6 और हैं, but just to हम एक अभी हम जस्ट टू 1 मिनट की या 5 मिनट Yes, I will provide you with Dr. Amit. I will provide you with all the samples in a few minutes. So आपको मैं ब्रेकआउट रूम्स में डाल रहा हूं, वेयर आपने अब तक जो सीखा है वो आपस में डिस्कस करेंगे। यू विल हाउ कैन वी अप्लाई दीज प्रॉम्प्ट्स इन आवर डे टू डे लाइफ विद स्टूडेंट्स, इन आवर टीचिंग प्रैक्टिसेस, ये आपका क्वेश्चन है। एंड फॉर नेक्स्ट 5 मिनट्स यू विल ऑल डिस्कस दिस इन द ब्रेकआउट रूम। मैं आपको आप 4 ब्रेकआउट रूम्स में डाल रहा हूं फॉर 5 मिनट्स।
Good morning, sir. Sir, repeat the question. What's to be discussed?
The question is, how can whatever we have learned so far, how can we apply it in our day-to-day teaching activities?
Thank you, sir.
Hello.
So all of you are back. So थोड़े से prompts अभी और हैं. पहले just what was the general thought processes in your breakout room discussions? Anyone would like to respond? One from each group.
Sir, I'm
Yes.
Dr. Shubha. I'm from Coimbatore.
Okay.
Sir, actually, we didn't have much of a discussion, but I have used AI, and we have used for creating lecture outlines, lesson plans, which are very tedious, I mean, lengthy processes. With a
Yes.
good prompt, we are able to, and even we can upload samples of lesson plans, upload a PDF, and then we can ask the generative AI to create a lesson plan and a lecture outline for any
Yes.
particular topic. And I
Yes.
have also used it for creating OSCE stations and clinical scenarios, case scenarios for mock patients for simulation-based learning.
Okay, very good. Yes, that is a very useful applications which almost all teachers can use. And many of these prompts, they can be used there.
Thank you, sir.
Anyone else? How our students can use them?
Instead of students using the AI without telling us, it is better that we suggest if you are using AI, make
Yes.
sure you upload the PDF and ask the AI not to take it from the, not to take information from the internet. Get information only from the content which you have uploaded and find answers to the questions that you have been asked.
Yes.
So that is a better way of the students learning. And we can have a short session with students on how you can use AI to improve your learning, especially for slow-paced learners who are not able to understand certain questions. As you had shown, sir, when you click slash, that is something new which I have learned. So the students can revise their lessons. They can also try
Yes.
and understand certain
It
concepts
keeps
which they
on
are not able
asking
to
you
understand.
very good questions.
Yes, sir. That is something new which I have learned today. Thank you so much. I will immediately use it tomorrow so that it reinforces what I have learned today.
Yes.
Thank
We
you,
will
sir.
be also be providing you with the summary of this.
So for the students, if students can prepare the notes, if the lesson is too huge and if they have less time, so they can just go through the notes with the help of AI. They can, make the notes of that particular thing. That could help the students in long run, just to revise it quickly before
Yes.
exams.
Yes. And especially if some rare disease is involved, they can get a differential diagnosis. It is like what a plane does to their foot, this does to their brain.
True, sir.
So because, you know, there is a issue that because of the computer, because of the AI, the intelligence level of students is falling, or people is falling. They are just depending upon uh, AI. But the real challenge is to use it as a tool and as a process, increase your intelligence. That is the key challenge, and many people who are at the top level, they are not using AI as something which is just uh, just use it blindly, but rather use it as something for long term, for improving themselves further. That is the main. Okay, we'll just move forwards. So next is markdown prompting. Generate now. Markdown is in which there is it is arranged sequentially with proper section headings, and see how it is done. A proper syntax is there. Hypothyroidism, third year duration, learning objectives, question timeline, pathophysiology, normal thyroid physiology, secondary, tertiary, clinical presentation, discussion, organ management, pharmacological therapy, monitoring, special situation, hypothyroidism versus hyperthyroidism, clinical vignettes, formative assessment questions. So everything is made available in a sequential manner. Just two prompts more.
पानी की बोतल थर्मस दो चाहिए
बच्चों, this is called star prompting. Situation, task, action, and result. So we have got a lot to cover, so I'm just increasing the speed a little bit. Next is rewriting prompt. Supposing we have a report and we want to tell it to a patient and we want to give it to the patient in his own language. Rewrite this information in a patient-friendly language that would be appropriate for a 55-year-old high school teacher with no medical background. Use plain language. And I'll also add, use Gujarati language. Now the report is already there, but this only a pathologist or a oncologist can understand it. So I want this to be converted into a patient's language. So most of the audience here is from Gujarat, and they can just tell me that is it correct or wrong.
So it is beautifully translated and it is correct.
Yes. So sometimes it is our duty that we should be using the language which the patient understands. And this is a very good way that instantly you can give the patient a document which he understands. Then doctor-patient relationship will really be great. The biggest problem why there is a lack of trust between doctors and patients is because of communication, improper communication. So if we are able to use these recently, they said that in Bihar they will teach give the MBBS course in Hindi. The same is there in Madhya Pradesh also. So converting a whole book into a regional language is just in few minutes, less than 1 minute, you can convert the whole chapter into a regional language, which of course you will have to check it once, but it can be done. The next is debate prompting. This is the last debate. As you know, there are pros and cons. Debate the pros and cons of using AI for histopathology slide interpretation in cancer diagnosis. Present strong arguments for both and against implementation considering diagnostic accuracy, workflow efficiency, pathologist roles, training implications and ethical considerations. Include current evidence supporting each position and identify unresolved questions that needed for the research. So I just press this. Academic debate. It is searching and it is reading Nature. So arguments supporting the implementation, arguments against, ethical and legal issues, balance in interpretation, unresolved research questions, conclusions, and we have got a full debate, pros and cons. So these were the I will give you some material in the WhatsApp group, and also all these I can I'll upload in the chat also. Next
Thank you very much, sir, for giving the good prompts to us, so we can use our departmental subject prompts to get the results. Thank you very much, sir.
Welcome. So next we come, I have created one GPT. Now, in this, what we have done, that we have pre-programmed it. And I am giving you this in the chat box. I have also given it to you in the WhatsApp group also. You can try it in your laptop right now. AI agents in healthcare GPT. Now this it serves as an if you see its prompt, it is a very big prompt which has been provided to it, and it is expertise. The role is very big. It can understand agents and explain concepts, planning, healthcare applications, hospital, a big biomedical waste, everything has been given, whatever agents can be created. So we'll just go back. So here I will ask it, supposing suggest possible applications of agents in whatever your subject is. Say, I say physiology. Because you have to create, I mean, you have learned it, I mean, you know this, but you have to apply it in your subject. And it will not happen in one day. You will have to create a plan. You will have to create applications over it. It will take about a month for one department, and it will take a team. So for that, I have created this. So AI agents can transform physiology, education, research, laboratory, assessment and clinical aggregation. Since physiology sits in the basic sciences and clinical medicine can function as tutors, simulators, research assistant, laboratory guides, assessment engines and decision support systems. तो उसमें क्या क्या है? Now all of you do this exercise right now for your own subject. Physiology learning tutor agent, workflow, student query, knowledge assessment, and each part it has to be planned with the right application. Virtual physiology laboratory agent, simulate physiology experiments digitally, physiology practical examination agent, clinical physiology correlation agent, physiology research assistant. So each one can be created into an app or a tool. Physiology competency tracking agent, Viva examiner, multi-agent physiology education, advanced future applications, high impact physiology. So it will take quite a lot of time to apply it. Give me applications in, say, agentic applications in orthopedics. So it gives a triage agent. Basically the goal of agents is to reduce your work. And because what is these days happening, that time is decreasing, the amount of activity to be done is increasing, and everybody is so frustrated. Once some work is taken up by the agent, then the mind will be freed for higher thinking. These days, almost all teachers, we are frustrated with lot of work which is repetitive, boring, and anything which is repetitive can be given to an agent. But you will have to spend some time in creating these. It will be good if some of you learn the basics of, or you have one person in your college who is an IT specialist. But these days, most IT specialists don't know about medicine. So time is coming when both branches, they come together. And this way, if we have to improve our medical education system, then some work will have to be automated. That this is repetitive, the student does it, student is also happy, he can do it repeatedly till he becomes proficient. And the log will tell whether he has learned it in 10 attempts or 15 attempts. He can do as much as he wants. He can do 24/7. Even if he wakes up at 1 in the night, he can still do it. and the learning can be done. Lot of tools are available. So I hope all of you have this, and I just share this uh, in the chat box. Whatever we have done, I'll just in the chat I'll upload. It is not allowing me to. Okay, I'll just put it in my Google Drive, and then from, because it is not allowing me to put it in my. I'll just send you the link. Anyway, let's move forwards. Skyworks. I'll take you to another tool which is called Skywork. Can you see my screen?
Yes, sir. Yes, sir.
Yes, sir.
It's showing Skyclaw.
Skyclaw. Can you see Skyclaw? Okay.
Yes.
Just a moment. हेलो अच्छा मैं आता हूँ अभी थोड़ी देर रुक जाओ somehow it's not visible on my screen.
So it shows, hi, I am Skyclo, and
Yes,
questions
yes,
questions
but
to be asked.
yes, just a moment. There is some problem here. Yes, now it is. So this is there was this is one you must have heard about OpenClaw by Claude, and this has been this is one of the very good tools which I have seen. So I have chosen one. A number of them are available, but this one I see that this can create PowerPoint, it can create documents, images. So let's see. I'll ask it. Please give means patient education material on, give me a topic, subject, which disease? Anyone?
Diabetes mellitus.
On diabetes mellitus in which language?
Sir, Hindi.
In Hindi. Okay. So I command it. No, just a moment. I have committed a mistake. I have to do it again. Sorry. So can you see now?
Yes, sir.
Make a patient education material poster on diabetes mellitus in Hindi. See, I just have to give it a little bit hint what I want. Everything else it will do automatically. And now I have to select images. This step I had forgotten to do it. So it is create, edit, and refine images in one place on diabetes mellitus patient education material. And then it is an agent, built-in agent. And it is making now there are a number of websites which they have created web agents of on everything, and people are this artificial intelligence is evolving into agents. The earlier method where we are used to ask questions and it used to give a big point that is now evolving, and agents are taking over. Agents, what is an agent? Agent contains a big database behind it, petabytes of data, text, images, sounds, everything is available. And when you give it a command, it searches that whole ecosystem, and then it brings the entire data into one place, organizes it, and presents it in a presentable manner. This is an agent. There is a way by which information is available in a simple manner, but there is another way. So we will, if somebody can we take a 5 minutes bio break? While this
Okay, sir.
does Can you see my screen?
Yes, sir.
So in hardly 2 or 3 minutes, maybe, it has created a patient education material. HbA1c should be less than 7. जीवन शैली सुझाव, क्या ना खाएं क्या खाएं, complications also it has provided, चेतावनी संकेत. And you can edit it also if you think something is not according to your likes. You can even give it a command, and in 2-3 minutes it will just create easily.
सर ये स्काई क्ला में बनाया है, स्काई क्ला में बनाया है?
ये स्काई वर्क के अंदर क्लाउड का एक टूलेस क्लॉ क्लॉ वर्क वो इसके अंदर इम्प्लांटेड है.
ओके.
और मैंने इसमें कम से कम 150 बना चुका हूं. और इवन आई हैव मेड देम इन मीजो लैंग्वेज, आई हैव मेड देम इन तमिल, पंजाबी एंड व्हाट नॉट.
ओके.
किसी भी लैंग्वेज में आप बना सकते हो. एंड फ्यू मिनट्स.
पर ये फ्री वर्जन में है, पेड वर्जन में है?
ये पेड वर्जन में है.
पेड में.
ऐसे ऑल गुड थिंग्स इन लाइफ दे कॉस्ट लिटिल बिट ऑफ मनी. बहुत ज्यादा नहीं, लेकिन थोड़ा सा इट्स अफोर्डेबल.
जो आप कह रहे थे अराउंड 400 रुपीज पर मंथ,
वो चैट जीपीटी का है.
ओके.
ये 600-700 का है.
ओके.
तो
स्काई वर्क का मतलब अलग से लेना पड़ता है? स्काई वर्क के लिए मैं इसका सब्सक्रिप्शन अलग से सेपरेट है इसका?
इसकी सब्सक्रिप्शन अलग से है.
ओके, ठीक है सर.
और इसमें अब हम इसको हम डाउनलोड भी कर सकते हैं. और इसमें हम अपना लोगो वगैरह भी डाल सकते हैं. जो मर्जी कर लें, इसमें हम अपना नाम वगैरह जो मर्जी ऐड कर सकते हैं. और ये एक बटन दबाते ही ये डाउनलोड भी हो जाता है इन एज जेपीजी, एज पीडीएफ, एज पीएनजी, जैसे मर्जी कर लो. इसके अलावा हम इसमें पावर पॉइंट प्रेजेंटेशन भी बना सकते हैं, वेबसाइट भी बना सकते हैं, वीडियोस भी बना सकते हैं. ये हम इसमें मैं डाल देता हूं. पर वीडियोस बहुत टाइम लेगा, तो वो हम बाद में करते हैं. अब एक सॉफ्टवेयर है. हाउ मेनी ऑफ यू हैव यूज्ड गामा? Can you see my screen?
Yes, sir.
यस सर यस
अब इसमें ये बहुत ही अच्छा सॉफ्टवेयर है फॉर पावर पॉइंट्स ओनली, लेकिन और इसमें चार ऑप्शन हैं। एक तो हम जस्ट एक जो एजेंटिक पार्ट है एंड इट यू आप इसमें कोई आप अपना टेक्स्ट भी डाल सकते हैं और इसमें आप कोई बना बनाया टेम्पलेट भी यूज कर सकते हैं और अब आप कोई पीडीएफ भी अपलोड कर सकते हैं। सो वील जस्ट स्टार्ट। गिव मी ए टॉपिक जिस पे आप पावर पॉइंट बनाना चाहते हैं। हम छोटा ही बनाएंगे, लेकिन मतलब इसमें हम अप टू 60 स्लाइड्स बना सकते हैं।
स्ट्रेस मैनेजमेंट के ऊपर बनाओ।
हाँ,
स्ट्रेस मैनेजमेंट।
स्ट्रेस मैनेजमेंट, इसमें इसको हम 15 स्लाइड्स का कर सकते हैं। तो पहले ये आउटलाइन बनाता है, और हम इसको हमारे पास चार ऑप्शन हैं। मिनिमल मिनिमल में फोटोग्राफ ज्यादा है, कंसाइज में थोड़ी सी फोटोग्राफ कम है, टेक्स्ट ज्यादा है। डिटेल में टेक्स्ट ज्यादा हो जाता है, फोटोग्राफ्स कम हो जाती हैं। एक्सटेंसिव में फोटोग्राफ बहुत कम हो जाती हैं और टेक्स्ट ज्यादा हो जाता है। तो हमने चारों ऑप्शन में से कोई भी यूज कर सकते हैं। और ये अगर हम एडवांस मोड में चल जाएं तो हम ये इसमें यहाँ पर हम जैसे कह सकते हैं, ये देखिए कि हम क्या कह सकते हैं कि राइट फॉर व्हाट, किस तरह कॉलेज स्टूडेंट्स, बिजनेस लोग, टेक एंथुजियास्ट, उसकी टोन जो है हम प्रोफेशनल कर सकते हैं, एकेडमिक कर सकते हैं, इंस्पिरेशनल कर सकते हैं, ह्यूमरस कर सकते हैं। तो लेट्स, और मैं इसको जैसे कह देता हूं कि इन फर्स्ट 2 स्लाइड्स एक्सप्लेन टू ए 10 year old। ये एक बहुत अच्छा है कि भी अगर इफ द प्रेजेंटेशन स्टार्ट में आप 10 year old को समझा दो तो वो बहुत क्लियर हो जाता है। और मैं इसको इमेजेस ज्यादा मांगता हूं और टेक्स्ट कम मांगता हूं। एंड आई विल मेक इट फॉर कॉलेज स्टूडेंट्स। एंड टोन इसकी जो है मैं थोड़ी इंस्पिरेशनल कर देता हूं। एंड आई जनरेट, मैंने जनरेट दबा दिया। मैंने जो प्रॉम्प्ट्स हैं वो उसका लिंक मैंने चैट में दे दिया है। ये देखें ऑलमोस्ट 13 स्लाइड्स बन गई हैं। तो जो भी टोन हम चाहते हैं आइडियली ये आपका काम, जितने भी एजेंट्स हैं ये आपका काम काफी कम कर देंगे, सो दैट यू कैन थिंक हायर। ये देखिए, आप लुक एट द क्वालिटी ऑफ स्लाइड्स। आप इसको किसी भी लैंग्वेज में भी बना सकते हैं। और उसके बाद कोई चेंजेस करने हैं वो भी कर सकते हैं। और यू कैन डाउनलोड ऑल्सो, यू कैन ईमेल इट टू एनीबडी ऑल्सो। ये देखिए यहां पर ये इसका बना बनाया एजेंट है। एंड यू कैन शेयर इट ऑल्सो, and you can improve it, change spellings, make ये शेयर दबाते ही ये आप बाय लिंक, एनीवन विद द लिंक जो है वो आप कर सकते हैं। यू कैन शेयर इट एंड एनीवन copy share link, and I'll share this with you people, and you can share। और ये आप लोगों के उसमें पहुंच गया। सिंस ये स्टार्ट थोड़ा लेट हुआ था तो आई विल बी टेकिंग 15-20 मिनट्स एक्स्ट्रा। And one very important applications which has to be told to everyone, because इसकी बहुत यूजफुलनेस है। जस्ट अ मोमेंट, मैं एक मिनट जरा अब जैसे ये एक पेपर है और जिसपे हमने एक सेमिनार लेना है, एक नया नया पेपर आया है, तो हम क्या करेंगे, ये पेपर हो सकता है, इट कैन बी अ बुक चैप्टर, इट कैन बी एनी डॉक्यूमेंट विच इज प्री डिसाइडेड। तो हम क्या करेंगे कि हम इसमें जाएंगे गामा में, और क्रिएट न्यू और इंपोर्ट फाइल और यूआरएल, और अपलोड ए फाइल। ओपन। ये फाइल अपलोड हो गई है और उसको हमने प्रेजेंटेशन में कन्वर्ट करना है। ओहो, गलत फाइल हो गई है, जस्ट ए मोमेंट। ये पूरी फाइल जो है ना, पूरा पेपर इसमें अपलोड हो गया है, इंक्लूडिंग इमेजेस। तो मैं इसको, आई कैन मेक इट अप टू 60 स्लाइड्स, बट आप जस्ट फॉर डेमो आई यूज ओनली 10। नहीं तो टाइम लगता है, ऐसे ही 3-4 मिनट हमारे एक्स्ट्रा खराब हो जाएंगे, ऑलमोस्ट 30 सेकेंड एक स्लाइड बनाने में। कोई भी आपका जो जर्नल क्लब है, उसके लिए आपके पास अगर पेपर है, उसकी पीडीएफ है, तो इसकी फटाफट वो प्रेजेंटेशन बना देता है। We all have to make a strategy by which agents can be placed at different levels of our medical education systems in every department, so that our work is gets automated and we जो हमें इस वक्त ओवर इवन हमारा हेल्थ जो एक्रेडिटेशन है, जो इसके नैक के एक्रेडिटेशन है, उसके जो हमने डॉक्यूमेंट्स बनाने हैं, all that can be automated. जिससे कि हमारा काम जो है थोड़ा सा एक्यूरेट एज वेल एज लेस टैक्सिंग हो जाएगा, एंड इंडियाज मेडिकल एजुकेशन सिस्टम कैन प्रोग्रेस इन ए मच बेटर मैनर. दैट इज वाई हम कहते हैं कि वी आर ऑलरेडी दी फार्मेसी ऑफ द वर्ल्ड, और 5 साल में हम हॉस्पिटल फॉर द वर्ल्ड बनेंगे. बहुत सारे लोग इस पे काम कर रहे हैं. एक क्वांटम कंप्यूटिंग आ रही है, वो तो बिल्कुल ही आगे बढ़ती जा रही है. इंडिया इज वन ऑफ द पायनियर्स. अगर आपके पास आप गामा पे अकाउंट बना के ये आप अभी आप खुद भी कर सकते हैं. तो इन शॉर्ट ये पावर पॉइंट्स बन जाते हैं. तो लेट्स गो टू अनदर वन. suno.com. इसमें आप कोई भी सॉन्ग बना सकते हो. जो आपको कल रात को हमने दिखाया था, या जो व्हाट्सएप पे मैंने बनाए थे, गिव मी ए टॉपिक जिसके ऊपर मैं पेशेंट एजुकेशन का सॉन्ग बनाऊं.
ब्लड प्रेशर कंट्रोल सर.
ओके. मेक ए पेशेंट एजुकेशन सॉन्ग ऑन ब्लड प्रेशर कंट्रोल इन हिंदी. लैंग्वेज इसमें हम चाहें तो अपनी वर्डिंग्स भी डाल सकते हैं. और ये इसके थ्रू भी बना सकते हैं। ये देखिए इसने बनाना शुरू कर दिया है बीपी का खेल। 2 वर्जन बनाई हैं, हमें जो अच्छी लगे हम यूज कर सकते हैं। जस्ट मोमेंट, मैं इसको शेयर
दबाव है तो घबराना नहीं, रोज मापो छुपाना नहीं, नमक कम पानी ठीक, थोड़ी चाल हर दिन की रीति।
खाने में जो तेल है भारी कम कर दो ये बात हमारी, सब्जी दाल फल का साथ दिल को दे आराम की बात।
दवाई हो तो समय पे लो, डॉक्टर बोले वही करो, धीरे धीरे बदलो आदत, यही है सेहत की इबादत। बीपी बीपी कंट्रोल करो, बीपी बीपी कंट्रोल करो, नमक घटाओ
चलना बढ़ाओ,
बीपी बीपी कंट्रोल करो, बीपी बीपी कंट्रोल करो, दवा समय पर दिल को भरो,
तनाव छोड़ो
नींद सुधारो, बीपी बीपी कंट्रोल करो, सिगरेट छोड़ो
दूर रखो,
शराब कम या
बिल्कुल न हो,
मोटापा भी बोझ बढ़ाए, कमर घटे तो नंबर आए।
हर हफ्ते एक बार देखो, अपने रीडिंग नोट में रखो, कब सही आराम से मापो, दोनों हाथों से मिलकर जानो।
सिर भारी चक्कर आए,
छाती दुखे
तो देर न पाए,
तुरंत कहो
देर न करो,
डॉक्टर से मिलकर फैसला करो।
बीपी बीपी कंट्रोल करो,
बीपी बीपी
बीपी बीपी कंट्रोल करो,
नमक घटाओ चलना बढ़ाओ,
बीपी बीपी कंट्रोल करो, बीपी बीपी कंट्रोल करो,
दवा समय पर
दिल को भरो,
तनाव छोड़ो
नींद सुधारो, बीपी बीपी कंट्रोल करो, छोटे छोटे कदम बड़ा असर,
रोज की आदत जीवन बेहतर,
परिवार साथ हो रहा आसान,
सेहत की रखो तुम पहचान।
बीपी बीपी कंट्रोल करो,
बीपी बीपी
बीपी बीपी कंट्रोल करो,
नमक घटाओ चलना बढ़ाओ,
बीपी बीपी कंट्रोल करो, बीपी बीपी कंट्रोल करो,
दवा समय पर
दिल को भरो,
तनाव छोड़ो
नींद सुधारो, बीपी बीपी कंट्रोल करो।
तो दिस वाज अबाउट सुनो। इसकी ये सेकंड सेकंड वर्जन है।
बहुत बढ़िया सर, बहुत बढ़िया है।
तो इससे आप किसी भी लैंग्वेज में आप कोई भी गाना बना दो, हैप्पी बर्थडे सॉन्ग बना दो, कोई गर्लफ्रेंड को खुश करना है वो बना दो, कुछ भी पेशेंट एजुकेशन मटेरियल्स बना दो, कोई एंथम बनाना है वो बना दो, किसी भी टॉपिक पे कुछ भी बना सकते हो। यू कैन चेंज द म्यूजिक, यू कैन चेंज द साउंड्स, यू कैन चेंज द विद मेल वॉइस और फीमेल वॉइस। अगर मैं सुनो भाई टाइम लगाए तो 2-3 घंटे सुनो मैं, और इतने ऑप्शंस हैं। तो
Suno is free or it's a chargeable?
इट इज स्लाइटली पेड। आप 1 महीने का ले लो, उसमें जितने मर्जी बना लो, तो उससे आपका काम हो जाएगा। थोड़ा सा तो बिल्कुल फ्री नहीं है, पर हाँ 700-800 रुपए तो है ही है महीने का। उसमें आप बहुत सारे आप एक्स्ट्रा उसमें ले सकते हो। मतलब मेरे पास एनुअल अकाउंट है, तो आप जितने मर्जी कहो मैं बना भी के भी दे दूंगा। एनुअल अकाउंट थोड़ा सस्ता पड़ता है।
सर 1 महीने का लेके भी छोड़ सकते हैं?
हाँ हाँ।
सही। मैं अपनी नेक्स्ट क्लास में ट्राई करूंगा इसको डेफिनेटली।
हाँ, आप फोरेंसिक मेडिसिन के किसी भी टॉपिक पे बना सकते हो।
हाँ, मैं वही नेक्स्ट क्लास में आई विल।
हाँ, मतलब इसकी अगर एप्लीकेशन निकालने बैठो तो कोई अंत ही नहीं है। म्यूजिक एंड वीडियो जो है ना, वो उसमें आप बहुत कुछ कर सकते हो।
सही है, सही।
नेक्स्ट वी कम टू, हमारे पास एक बज चुका है, लेकिन मैं एक्स्ट्रा टाइम दूंगा। आपको वहां से कोई लंच लंच के लिए बुला तो नहीं रहे?
नहीं सर, लंच है, लेकिन आप 15 मिनट ले सकते हैं एक्स्ट्रा।
ओके।
सर सेकंड सॉन्ग की डिमांड हो रही है, आपने बजाया नहीं बीपी का।
मतलब वो फिर उस वो और 3-4 मिनट और ले जाएगा।
ठीक है सर, तो ये आप कंटिन्यू रखिए।
हाँ
ग्रुप में शेयर कर देना वो।
हाँ। तो ये जो है नेक्स्ट हम कम आते हैं नोटबुक एलएम। ये बहुत ही सुपर पावरफुल टूल है, जो सबको आई थिंक बहुत सारों को इसके बारे में पता भी होगा।
तो सुना है पर अभी तक ना यूज नहीं किया, मतलब कुछ आज
अच्छा,
यूज करना शुरू कर लें हम इसको।
मतलब ये तो अ, अगर मान लो आप, लेट्स सी, अब हमने यही एक जो हमारा था अ,
जो आपने गामा में दिखाया था, जो आपने पीडीएफ अपलोड किया।
हाँ, वही उसी को ही ना, उसी को मैं इसमें अपलोड करता हूँ, अपलोड फाइल्स।
आप शेयर स्क्रीन नहीं किया हो सर आपने?
अच्छा अच्छा अच्छा, 1 मिनट जरा। तो मैं जीरो से शुरू करता हूँ। मैं समझा तो मैं शेयर किया हुआ है।
नहीं, अब शेयर हो गया।
गो गो टू notebook LM. This is the most powerful tool for many activities. तो इसमें जैसे क्रिएट न्यू नोटबुक पे प्रेस करें, और इसकी खास बात यह है कि इसमें हेलुसिनेशन हो ही नहीं सकती। और इसमें आपको पहले आपको अपना डेटा देना पड़ता है। हाँ, अब हम वही का वही जो हमने रेड सेल मॉर्फोलॉजी एंड वो आर्टिकल हमने अपलोड किया, इट इज रीडिंग दैट आर्टिकल, ये अपने डेटाबेस में डाल रहा है। इसके लिए इसमें खास बात ये है कि इसमें आपको कुछ अपना डाटा देना पड़ेगा। इट कुड बी टेक्स्ट, इट कुड बी वीडियो, इवन ए यूट्यूब लिंक। और अब मैं इसमें दबा देता हूं इन्फोग्राफिक, और इसमें माइंड मैप भी दबा देता हूं, और इसमें स्लाइड डेक भी दबा देता हूं। तीन ऑप्शन मैं इसमें दबा देता हूं। एंड आई ऑल्सो प्रेस वीडियो ओवरव्यू, जनरेट। यहां पर मैं नंबर ऑफ आर्टिकल्स भी बढ़ा सकता हूं, एक की बजाय 15 या 20 आर्टिकल्स भी दबा सकता हूं। और इसने मेरा सबसे पहले तो मैं एक माइंड मैप बना दिया। सी, उस पूरे आर्टिकल का इसने माइंड मैप बना दिया। एंड आई कैन इजीली यूज इट इन द क्लास। इसको मैं डाउनलोड भी कर सकता हूं, यहां से दबाते ही डाउनलोड हो जाएगा। ये पूरा माइंड मैप डाउनलोड हो गया। I can increase its size, I can decrease it, whatever I want to do. Then we come back. थोड़ा सा टाइम ले रहा है ये। अब इसने इंफोग्राफिक बना दिया। उसी आर्टिकल के ऊपर इसने पूरा इंफोग्राफिक बना दिया, एंड बहुत ही अच्छे बनाए। जो मैंने आपको व्हाट्सएप ग्रुप में शेयर किए हैं वो सारे नोटबुक एलएम में बने हैं। इट इज टेकिंग सम टाइम। इसमें मैं ये भी कर सकता हूं कि अपना टेक्स्ट डाल दूं, एक कोई बुक का चैप्टर डाल दूं, और इसमें एक ऑप्शन है फ्लैश कार्ड्स। एंड देयर इज a क्विज ऑप्शन ऑल्सो। मतलब ये बहुत ही अच्छी पावर पॉइंट प्रेजेंटेशन भी बना देगा और वीडियो भी बना देगा, फ्लैश कार्ड्स भी बना देगा, क्विज भी बना देगा। ये देखिए फ्लैश कार्ड्स आ गए। सारे क्वेश्चंस उस होम का आंसर वो जो मैंने आर्टिकल अपलोड किया था उसके ऊपर, उसके अंदर ही है। ये देखिए एक्सप्लेनेशन भी आ गई। हु वाज होप्स फ्रायर। अगर आपने कोई आर्टिकल पढ़ के उसको उसके बारे में कि मेरे को कितना आता है, ये टीचर कैन ऑल्सो यूज ऑन द स्क्रीन कि ये लो आर्टिकल, और उसके बाद उसके फ्लैश कार्ड स्क्रीन पे करते रहे। 60 फ्लैश कार्ड्स बन गए हैं। और इसकी एक्सप्लेनेशन भी यहां आ रही है। सी, तो गलती हो ही नहीं सकती क्योंकि इसने आंसर सिर्फ इसी आर्टिकल में से लेनी है,
सही है
फ्रॉम ए डिफाइंड नॉलेज बेस। ये एक की बजाय 10 आर्टिकल भी हो सकते हैं। The teacher can show it on the screen also, और क्वेश्चंस पूछ सकता है। स्लाइड डेक में थोड़ा सा टाइम ले रहा है, ऑडियो में शायद कम लगता है।
ये भी पेड होता है या फ्री है सर
ये स्टूडेंट्स के लिए फ्री है,
ओके
1 साल के लिए।
ओके
आपको शायद अपना कॉलेज का आईडी वगैरह देना पड़ता है।
ओके
पर क्योंकि मेरा सारा एमयू इंडिया का सेटअप, उसमें इतने सारे वो भी हैं, गूगल क्लासरूम्स, और इवन जो आप गूगल ग्रुप है वो भी 40,000 के कारण वो पेड कर दिया हुआ है, तो उसमें उसी में ही आ जाता है सब कुछ।
हम्म तो
जस्ट
सही है
सी
सर,
अगर,
समझ लग गया, सही है।
हाँ नहीं, आई जस्ट सी अगर मेरे पास कोई है। अच्छा, एक मैं और आपको दिखाना चाहता था, इमरजेंट। इमरजेंट में आप इसको टॉपिक दो तो ये आपकी वेबसाइट बना देता है। ये देखें, मैंने इसमें क्या किया कि मैंने इसको कहा कि मेरे को एक make me an app to monitor immunization in a village. In a village, add all the possible immunization for medical also. The name is Dr. Vedi's hospital. तो इसने मेरे को अ, कुछ मिनटों में, तो कुछ मतलब 10 मिनटों में ये वेबसाइट रेडी हो गई, जिसमें मैं साइन इन भी कर सकता हूँ सारी। अ, इसने क्लॉड का यूज किया है। आई कैन यूज कौन सा डेटाबेस यूज करना है, और 10 मिनट में पूरी वेबसाइट एक विलेज लेवल के लिए रेडी है। इसमें हम कुछ भी कर सकते हैं, हम इसको कोई टीचिंग वेबसाइट, कोई डिपार्टमेंट की वेबसाइट, कुछ भी कर सकते हैं इन फ्यू मिनट्स।
ये नोटबुक एलएम में उसी में है ये?
नहीं नहीं, ये इमरजेंट,
अच्छा,
इमरजेंट।
ये अमरजेंट, अच्छा अलग है ये, अमरजेंट हो,
हाँ
ठीक है सर।
हाँ, इसका मैं, होते तो सारे ही पेड़ हैं, थोड़ा बहुत तो लेते ही हैं।
हम्म,
एक ये फायरफ्लाइज है। फायरफ्लाइज में क्या है कि जैसे अब ये हमारी इस वक्त चल रही है मीटिंग, तो ये उस मीटिंग का ये उसका बना रहा है
मिनट्स।
समरी, हाँ मिनट्स बना रहा है और बहुत ही अच्छे बनाता है।
ओके, तो ऑनलाइन मीटिंग भी जो हम डिस्कस कर रहे हैं
हाँ
तो कैप्चर कर लेगा।
कर लेगा।
हमारी जैसे थीसिस रिसर्च मीटिंग होती है, जहाँ एथिक्स कमेटी मीटिंग होती है, तो अपने
हाँ
आप
हाँ
ही मीटिंग्स साथ के साथ डिस्कशन के हिसाब से बन जाएंगे।
हाँ।
सर, आपने ये पूरे वर्कशॉप में जितने भी जूम मीटिंग में लिंक भेजी है ना, वो व्हाट्सएप में आप भेज सकते हैं
या फिर पावर पॉइंट बना के सर?
नहीं, क्या कह रहे हैं? मैं व्हाट्सएप में भेज दूंगा।
ओके, थैंक यू सर।
गुड आफ्टरनून बेदी साहब, डॉक्टर सुनील पंजवानी हियर।
यस
सर,
सर।
अगर पूरा हो गया तो हमको प्लेनरी सेशन है 2 बजे,
हाँ
तो
हाँ,
लंच
बस एक
लेना
मिनट
पड़ेगा।
में, मैं 1 मिनट में ये देखता हूँ अगर कुछ है।
श्योर सर।
और मेरे को कुछ फीडबैक भी स्टूडेंट से, लोग अगर 1-2 मिनट फीडबैक दे दें।
श्योर सर।
तो ये देखें, ये पावर पॉइंट बन गई है।
आपकी स्लाइड्स शेयर, चलो सर, अभी वैसे टाइम हो गया है ना आपका।
हाँ
आपकी वैसे स्लाइड शेयर नहीं हो रही थी अभी,
एक
पर
मिनट
ठीक है
जरा।
सर। ठीक है, अभी ना
हाँ
वी हैव लर्नड अ लॉट, बहुत सी चीजें नहीं सुनी आज। तो सुनो, आपका
चलिए,
सॉन्ग
प्रमोद
वाज
गोयल
वेरी
सर
गुड।
फीडबैक दे रहे हैं आपको।
हाँ
यस,
गोयल
हाँ
सर प्लीज सर।
that songs, how to make the songs was very good. And even that notebook LM, although we have heard it, but uh, I believe that many of have not yet used it. And I hope with your demonstration we will be able to use that. And the other thing, gamma, that you showed, we can make very good presentations on that slides. And then in the starting you have told about a lot of prompts, that one
हाँ
example prompt and two examples prompt, that again star exam, star, co-star. So that was again very helpful. And then latest you were showing this emergent, that we can make the website also.
हाँ
And
जी
one other you showed that minutes of meeting can be recorded, you know, so
हाँ
sir,
जी हाँ जी।
everything this was very helpful. And
तो
मतलब आजकल जितना मतलब हमारा वर्कलोड इंक्रीज हो रहा है डे बाय डे, तो वी नीड टू नो अबाउट ऑल दीज एप्स, अदरवाइज इट्स नॉट पॉसिबल टू everyone, even regulatory bodies, everyone, whatever na authority, they say send this information, send this information. So we have to use all this AI, otherwise it's not possible to do manually all these things, sir. So thank you very much, sir, for doing this.
Thank you,
थैंक
Goel
यू।
sir. Thank you, Goel sir. Now, Dr. Jigna Trivedi, madam. She is in charge medical superintendent, Sarati Hospital, Bhavnagar. Please, ma'am.
Good afternoon, sir. Uh, it was really very nice to hear from you since morning. At the 11th hour, you have accepted our invitation and participated in. So, thank you very much for that, sir. And really, sir, there are now, it is like so many things are coming, sir, that we need to now have some focus, that which is good, which is not good, or which AI tool is appropriate for what function, that we could come to know that, because now there are multiple functions for which we can use an AI tool. Now, there are so many tools coming up in the market that we don't know actually now that which is best for what task. So I think that clarity we got after today's long deliberation, that what will be helpful in our day-to-day teaching, learning, and assessment activities, and some of the clinical side activities also, or some administration activities also, we can now do it more efficiently with the help of the AI tools. Thank you very much, sir.
Thank you,
Thank you,
Jigna ma'am.
ma'am.
Sir, on
So,
behalf of Medical College Bhavnagar, I, Dr. Sunil Panjwani, Organizing Secretary, thank you for your deliberation and your virtual talk for almost 2.5 hours. We will send you the certificate of participation and memento to your address. Thank you very much, sir.
thank you, thank you, thank you. So, I can end the session.
So we are concluding the session. Thank you so much, sir.
Thank you.
you.
Artificial intelligence. Because I think this is something which is so important today, and all of us are using AI. Recently, there was a survey in UK where they said that more than 83% of students using AI. And I think this is something which all of us should really understand, that students are going to use AI and teachers also will have to use AI. You know, the students always take the innovations first, teachers always follow. So I think we need to really see how the assessment is going to really change. Now, I would like to thank, of course, Chinmay and his whole team, as well as my team. Now, my objectives of my talk is what is role of AI in assessment, explore the AI tools for giving feedback, analyzing results, and personalized learning, and what should be done by colleges and universities to change into this whole scenario. Now, what has happened currently, the AI systems are increasing in everywhere, you know, whether it's education, clinical, medical schools are adopting curricula to include AI literacy. AI literacy has to be there for every medical student. Growth of AI powered learning tools and simulators. Emergence of AI native medical students. You know, most of our students are AI native. You know, if you ask anything, everybody has Chat GPT, Gemini, everything, you know, Perplexity and everything. And there are blurring lines between educational tools and clinical decision support. Having said that, one of the things which came in about 2-3 years ago were AI in education management. That management really had so many education management. What do I do to this? Okay, so you can see my video. Impact of AI on health education profession, practically on every step it has got impact. But today we are going to look at only assessment. You know, we are going to only look at assessment video and what has it really changed. So let's first see what are benefits of AI overall for the assessment. So AI is partner in assessment. I'm using these words very carefully. It's a partner in assessment. So there's a personalized learning path. That means every student today knows where I am. It's not a general class. Today's students would like to know what is wrong with me rather than the whole class. So how do I know about my personalized pathway? Am I doing well or not? Simulation of rare cases. Most important, today students want anything accessible 24 by 7. They don't want teachers to be seen only 24 or too few hours. They want him anytime. Most of the students work in the night. At that time, they want a question. How do I answer that question? And reduce administrative burden for teachers. Teachers also don't want too much of administrative burden. So AI in assessment, if you really look into this, simulate patient encounters, provide personalized feedback, evaluate theoretical knowledge, evaluate diagnostic and procedure skills, and evaluate emergency response skills. You know, so let's take few examples and then see how we can include them into university and colleges. The first important part of AI is content generation and testing. You know, we have to create questions. The biggest problem for the teachers, senior teachers, is to create MCQ questions. You know, MCQ questions was a big problem. I know we used to go and sit in NBI, MCI, and many universities and sit there. And at the end of it, we used to have 10 questions created by going by a whole 10 day. We used to add references. You know how difficult it was to set a paper in 2000. We used to go there, lock in particular way, and then we used to have MCT or something like that. Now, once you say MCQ generation has become one of the easiest thing with AI. Now, if you really see this platform you use, what is called as an RTF model. I just give you models. I'm sure we can go on this for hours together, but I'll give you one model that is role, task, and format. That means you say you are a biochemistry professor teaching medical students, create a 10-minute mini lecture on Krebs cycle with emphasis on how pathology, and then you create few questions with 8 slides and all. So creating knowledge is very different. You say as a teacher of pathology, you can create MCQs of different types of students undergoing class of headatic cyst. You have a class on headatic cyst, you have to take questions, you can have a single based response. This is all created by the this is all created by AI, and they create simple questions. Many times you realize, and these are true or false questions. There are matching questions, then multiple true and false questions. You can create match each item and all. These all can be there, and there are so many articles which you really see which talk about relevance of MCQs and AI creation, and they are all from the best journals. BMC Medical Education, MedSeam, ChatGPT, everything probably creates so much. So when you are creating an MCQ, you should be very clear what is my purpose and what is my topic. Your role and student's role. Always remember, prompt writing is very important. You say, I am a senior professor, and then you make it clear, I am creating an MCQ for a first year student. I am creating an MCQ for the third year first batch. I am creating a student for PG batch. I am creating for selection exam. So you have to have clarity about what role of student, level of students is there, what type of MCQ you want, and level of difficulty. Now, this is a most critical question. Remember, MCQ creation makes a lot of mistakes. It's not easy. They make mistakes. So you have to verify it anyway. So when you're considering using AI, you have to think about accuracy and reliability. While AI tools are becoming accurate, it is crucial to review and validate what is generated. Secondly, you have to consider ethically. Leaks and all are happening. You have to really consider what is really going to happen. And a human oversight is most important while creating MCQs, because sometimes the created by MCQ may be absolutely not clinically relevant, neither they are subject relevant, and you have to really look at that human oversight. So prompts are most important. When you make a prompt, first, I think if you want to really learn everything, first learn how to write a proper prompt. There are about 7, 8 models of creating prompt. If you learn the prompt, your outputs will be better. So like if you want to write a prompt, you say that you are an expert in medical educator, create a 5 multiple choice questions on topic for final year MBBS students. Each question should have 1 correct answer, 3 possible distractors, and a brief explanation about why the correct answer is correct and why the others are incorrect. Align the questions to Bloom's taxonomy of application level. And I can also say that give me 3 searchable by PubMed the references for this. I can add this. I can make it more and more specific, then I can use it very well. That is the first thing. There are so many apps which have come which help you to make MCQs. Like Quizlet, Socrative, Kahoot, quizzes. Now Quizlet is one which I like. It creates flashcards. Like you are taking a class. I can create flashcards and I can put those. For example, if you put a topic and your slides, it will create 25, 30, 50 flashcards. And then you can really get those flashcards, and the backside is a question and answer also. So you put that flashcard of question, let students think about it. You keep your students engaged. And that's very important today. Otherwise, students know this is going to be there available on the net. So if you create questions, students remain engaged. You create, Quizlet creates. What is evidence-based surgery? It will have answer also. What is the 4 key principles of evidence-based surgery? You will have answer also. It creates multiple Quizlets like this. There was a very nice AMI guide. I don't know how many of you really read. But this came, AMI Guide came in once, this came in about 2024. This is AMI Guide 178. It talks about artificial intelligence in health profession education assessment. So what I did, I actually put this guide into AI and Quizlet, and I asked them to create questions on this particular. It's a very interesting exercise you have to do just to see. So anyway, it gave many things like aim to allay the fear of change and all that kind of thing. But it created a question. What is the focus of AMI Guide 178? That was the first question was created. And there's an answer. It highlights that assessment results, and it created 178 flashcards like this. Now you can pick up 5 flashcards and put it. Don't put more than 5 or 6. But at every 5 minutes or 7 minutes, you put one flashcard and you will find that students engage. And then you just flip it so that the students know what is the right answer and they learn there only. So that is a better method of formative assessment which you can really do. What is the significance of adage assessment drives learning in the context of AI in HP? Such kind of questions it creates. Now, there are so many apps which create medical MCQ, like say Writing Mate, Medic MCQs, Neural Consult, Magic Forms. In fact, if you see, some of them are free. You can use them. QuizWiz, Geeky Medics, Editor AI, Question Gen. These are so many apps which create questions. So if you want to create a paper, I think it's about a half an hour to 1 hour job to me to create a question paper of 1,100 questions for students. So it's become so easy today for creating an MCQs, and you can really do that. There are many things like Quick Gizzo, Question Pro, Chat PDF. Can you do so many questions like this? Let's come to the essay questions. If I just type in Chat GPT or Chat PDF and say, I need essay questions, it will create so many essay questions to you. Now, I can give a prompt and say that I want a question on the life cycle of hereditary cyst, which is specific to the second MBBS microbiology curriculum of Bhavnagar Medical College. Then, if there is some paper available, then I'm sure it will create like that. Or I say, okay, Gujarat Medical University's curriculum, based on that, I want this question, you will get that question. So it is not out of syllabus. The whole question is, then it is in the syllabus. And then you can really have so many questions. You can say what is the marking strategy and all. Now, the next thing is that automated essay scoring systems. Now, see, most of the time, the trouble was how to correct those essays. Essay questions, you have to go down and sit and all. So this was an innovation which came in 2014. But unfortunately, not much has been done on this. This was done, the system was created. But recently, there was one paper in HPE 2025 that it says LLM grading, right? With ChatGPT, I mean, basically AI grading of tools for preliminary scoring of student assessment in SAQ grading is efficiency and improvement, and it is not as a replacement for, but faculty involvement in the grading process. So what I would do actually, what normally people would do now in the West, there are universities, they put say 100 students questions and they see if within the range it is there between say normal range, you only look at above 10% and below 10%, last 10%. Those who are failing and those who are about 10%. So your teacher job becomes less. Those who are routine, you normally just have an overlook and you can just confirm. But those who are failing, you go more in details about them. See whether they are really failing or they are passing. And those who are getting 90% and above, you really go and see whether they're really worth of getting it. So, you're reducing your administrative burden by checking at it. The third thing which has changed is OSCE stations. Today morning, we had a lot of workshop on OSCE, but OSCE stations can be easily created by, these are clinical platforms, you can find free questions, you have free ECG case collection, everything you can get into any of these sites. There are geeky medics, these are something where you can get patients, you can get virtual patients. In medical education, this was a paper which came in 2024 that in medical education has a very strong potential to reduce examiner bias, provision of detailed feedback, simulating clinical scenarios, and you can really completely change. This was a systematic review. I request you all to read about this so that this is something where it has changed the way people create OSCE stations. Then whenever you are buying simulation labs, try to buy this SIM capture and OSCE. Lauder has wonderful SIM capture program. So those who are buying SIM capture, they have wonderful kind of thing like setup, execution, evaluation, debriefing, and they give you remote and in-person OSCEs. I can conduct OSCE in my institution sitting here. I can set up the whole thing on my simulation. I can see students what they're doing, and I get at the end analytics that my students have done this. And this is the SIM capture program, which is there. There are integrated data capture. So, I know what my student is doing in my own college. So again, most important is prompt for OC. You write design and OSCE station and scenario, instruction to candidate, instruction to examiner, checklist with marking scoring thing, ensure it tests both knowledge, skills, and feasibility to run in 7 minutes. I write a prompt properly and I get a proper kind of an OSCE. I can do it for pathology, identifying gaps in students' responses in pathophysiology, AI-based ECG interpretation. There are so many apps I can use for interactive video assessments. You can do anything, something like automated analysis of OSCE. If somebody has done OSCE, like I think IRA tried to do this. IRA has tried to do automated analysis. That means the student is working in a simulation lab, scores have been collected, and you're automatically getting those scores, examples and benefits. Then you will find the third thing which has come up in a very big way is virtual patients. Now, it's a very common thing what we used to say, KEM has so many patients, why do I need virtual patients? But today, a lot of ethics has come into picture. I think ethics is so important that today I cannot, previously when I was a student, 20 students used to do PR, PV, or they used to do examination of a pregnant woman. Today, even in a public hospital, a lady will not allow you to touch more than 2 students. So then how do your students learn a breach or something like that? Now, this is where I feel the virtual patients, then talking to patients, getting the feedback from the patient. This is where simulation labs make a lot of difference. And virtual labs are important for you for history examination. So what are the types of virtual patients? The first is scripted virtual patients. There are now enough amount of scripted virtual patients where there are histories, they enough provide details. And for example, I don't know whether you have seen, you have a patient like this where I can talk to the patient and patient will give me feedback. I'm getting a pain in the right iliac fossa. Then I have to ask patients, did you have vomiting? Then she'll say no vomiting. And at the end, they'll give me feedback that you asked history of vomiting and pain, but you did not ask the history of fever. So I get a feedback. My analysis is done and I get feedback that I should have asked, this is an important point, I should have asked it. Now, this kind of a feedback, no clinic or no student really gets today, which you get by these virtual patients. Then artificial intelligence driven interactive patients. Now, this is where you find there are patients like say abdominal pain 1, abdominal pain 9, there are so many patients, anxiety patients. So you can really talk to these patients. I don't know whether you have really discussed. It's interesting. Hi, Chris, my name is John Smith. My date is so-and-so. And then they'll tell you. Now there are a lot of Indian hospitals are coming with, like say AIG has now Meera. If you talk to Meera, she will answer all your questions. And then at the end, you'll get feedback also. That this is what it is, you have done well or you're not done well. The third thing which has come is avatar-based patients. I don't know how many of you really know. You can create your own avatars. I don't know how many of you have created your own avatar. But I have created my digital twin or avatar, and then it talks like me. You can change your voice tone and everything. It's one of the most interesting world you can go into this. You have many times avatars, something like stopping antidepressant. Now you talk to this patient, you can ask history, they'll give you ideas, you can learn everything. You can just type in PubMed, avatar-based patients. There are 272 publications on avatar-based patients. Imagine how the world is moving. And many of you, I'm sure, must have learned this term now, but there are already 272 papers. That means how much we have progressed into this. So there are a lot of hybrid models. Now they're combining virtual plus live patients together we are doing. So this is what it is. So now how do we use virtual patients into assessment? Now that is the next point. So what we can do, we can simulate patient encounters. We can provide personalized feedback, evaluate theoretical knowledge, diagnostic and procedural skills, evaluate emergency response skills. So AI-driven virtual patients, you can really do clinical reasoning. which is not really tested. You can do it. There was a paper in Nature, 2023. It says avatar-based patients monitoring improves information transfer, diagnostic confidence, and reduces perceived workload in an ICU. See, they created patients like this. This is an ICU patient with monitors and everything. And now you are treating a postgraduate of internal medicine, is treating him, and you know how he's manipulating and how he gets stressed and everything. And then they really see what interventions he's doing. You know, you can create everything here, and you look at the satisfaction of students. All the green is all satisfied students and teachers. So everybody found these experiences very well, and I think this is way it's coming up. You know, if you really see how kind of satisfaction they are having. NLP based communication skills evaluation, you know, these are something which is now newly coming. AI evaluates aspects like empathy, clarity, completeness of information, and professionalism. You know, there's a program called Body Interact, where you can touch the patient's that screen and you can get the feel, and then that way you can really get the empathic feeling how you're doing and everything. It's a very interesting kind of apps you will find, and they give feedback to you, you know, basically. So this is what about patients and content generation. Let's go to the next phase and see how you get a predictive analytics of a patient with AI. So for example, you know, learning analytics has become the most important aspect in medical education assessment. Now, what I'm learning is somebody analyzing my learning. You know, my 7 or 8-year-old granddaughter will ask me, am I doing well? What is happening to me? Why I am not able to do this? Can I do this better? And, you know, they are worried about their own performance. The new generation is always worried about it. We were never worried so much in our time, but now they are. So now you will find learning analytics has changed something. So there's a data collection, data aggregation, and analysis and reporting. So what do you really mean? I'll give you an example. I'm a surgeon and I have my residents who are doing laparoscopic cholecystectomy. So they come in the first year and they want to learn laparoscopic cholecystectomy. How do I know they are doing well and whether they're not doing well? So what they do, you take your resident's video from simulation or from the surgery, and I put it to analysis. And it gives me complete analysis. How is his hand working? What is the balance of his hands? Is he able to really moving fast or slow? And that will help me to give him exercises to make his hand more stable. You know, what a level of analytics. And you will find there's a paper, this was paper which said that if you learn with learning analytics, students always learn better than learning without analytics. Not that they will not learn, they'll take little time, but they'll never reach to the level which they will go. So there's something called as an Can we go ahead? Okay. So there's something called as the AI tutoring and remote expert instructions. Now today, my tutor may not be in Bhavnagar. He may be in Mumbai, maybe in Germany, maybe Singapore, everywhere. I can physically, with the hologram, talk to him and he can teach. And that is what has become now analytics. You know, AI tutoring feedback is very important. Because of the time, I'm not showing you many videos. But what is most important is longitudinal performance monitoring. That means I'm not looking only at one task. I'm looking at your whole performance in 5 years, 3 years, 2 years. What was the concept of milestones in 3 years now has come into this. With AI, it has become very good. So the second thing which has come is what is called as an adaptive testing. What do you mean by adaptive testing? You know, today we give 100 MCQ questions to the whole class and we give them a score. We never test the student's real ability. What is adaptive testing? It will create a questionnaire based on how well difficulty he solves. If the student solves difficult questions, it will go to higher level questions. It will create more higher level questions. So this is called as adaptive testing. So you can write a prompt, create a 10-question adaptive quiz on this particular topic, beginning with moderate difficulty questions and then increase or decrease difficulty based on learns previous answers, provide feedback after each question. You know, people do it now so nicely. And then I know that how to really adopt. And this is called an automated reflective essay and professionalism assessment. You can also study their reflective power. You can look for their ethical reasoning, empathy, insightfulness, and it gives feedback to best to you. These are the things which were never used to assess. And remote procedures skill assessment with accuracy and technique. Now, one of the things which has emerged over a period is gamification. Our new students like gamification. Something like simulation games, pediatric sim, touch surgery. I don't know how many of you really learned this. Diagnostic reasoning games. Kahoot and Mentimeter should be there in every class where students, you give questions, make them, and students enjoy these Mentimeter and Kahoot and Socrative and all. They really enjoy all doing all this. So assessment aspect of games. So games are now used for formative assessment in a deeper way, and they improve critically your choices. Okay. But there are always validity and reliability issues. You will find this is not so easy, AI to use in assessment. Validity and reliability are very important. So what are the validity issues? First thing, factual inaccuracies and misleading content while creating MCQ. So check everything. You have to check each question and see whether it is correct. Does it fit to your clinical mind? Secondly, for example, I was trying to show that example. Misdiagnosing menopause in a diagnosis for a male patient and misdiagnosing as menopausal syndrome in a young patient, something like that. So they can make mistakes, ectopic pregnancy in a male patient. So you have to be very careful about these kind of questions. Then construct underrepresentation. Most of the questions created by the AI are simple recall or low-level questions. Unless you give a specific prompt, they will not. They also don't want to work. They are very lazy. AI is also lazy. So you have to really make AI work harder to get complex questions. You have to add a prompt according to like that. Bias. I'm sure many of these questions are based on the global north or gender stereotypes. So you have to add our own data. Lack of contextual relevance. Sometimes it gives a question which is not related to your life practice. So think about it. And opaque decision making. We don't never know how the AI has taken that decision. AI generated multiple choice questions of high stake emergency and medical exam were identified easier than expert written questions and showed more instances of factual inaccuracies, irrelevance, and flawed technology. This was in 2025 paper. So remember, though AI is good, it has always need to validate it better. Reliability is always problem with AI. Inconsistency in output. You put a different prompt, you get a different answer. So you have to put your prompts in a standard way. So there are, as I said, models you use. Difficulty and discrimination variability. As I said, most of these questions are human-made, are simple. Then limited reproducibility. It never reproduces the same thing. Sometimes you use free versions. It gives outdated information and fabricated references. So use paid versions. Nowadays, many of these paid versions are available at 300, 400 rupees a month or 500 rupees. Use them. They are better for using free versions. Okay. So the most important question is, how do you implement this in your own institution? You want to begin with today. What should universities do? What should colleges do? Now, this is a wonderful difference between the traditional and AI assessment. Okay. Traditional material and AI-driven assessment. Periodic high-stake blocks. Some soil we need to have continuous low-stake blocks. Delayed feedback. Here is instantaneous feedback. Here, for rote knowledge versus clinical reasoning can be included. And of course, you have a grading objectivity. And there are many other features between AI and traditional assessment. But I would like you to read this paper which came about 3 months ago. Very interesting paper. It was AI for assessment in medical education in the post-LLM era, a scoping review. This was a paper which came in February, and this was a wonderful paper. And what did it really say? They took 25 studies where they have used AI in assessment, and they said that AI-assisted generation of MCQs across demonstrated efficiency gains, acceptable difficulty. They have not said that it is really very poor. It is acceptable. We can improve it on it. Limitations were shallow reasoning, low level, weak distractors, factual inaccuracies, and reduced discriminating power. And NLP and LMM analysis has showed increasing maturity. So as the systems are growing, machine learning is happening, we are getting better and better. Okay, so this was a systematic review. So overall literature supports that AI is assistive rather than substitutive in tools. So AI should assist you working. So the first question is, what should colleges change? Traditionally, assessment measured what students know and can recall. Now we have to change our question: what students can do with knowledge, how they think, and how safely and ethically they apply AI-assisted information in the patient care. Remember, the question is so different. Today, in fact, in the morning, while doing OSCE workshop, I allowed all the participants to use AI because I wanted to think that this knowledge is available to you. How will you use this knowledge? How will you use it ethically? How do you see that the information is used correctly? So we have to teach our students completely differently than what we were doing before. So why assessment must change? Knowledge recall is no more longer sufficient. We don't want knowledge recall now at all. Forget about recall. Most of the students on the round also go to Google AI and find out. They don't need to remember who was there and what is the level. Everything is available on GI. So therefore, assessment should focus on clinical reasoning, decision making. For example, instead of asking, what are the causes of jaundice, ask students to evaluate a AI-generated differential diagnosis and identify errors. We need to now change our whole pattern of education and how we are going to do it. Assessing critical thinking, we always worry about critical thinking. Verify AI outputs, identify bias, provide all AI-generated management plan, and ask students to critique on it. Ask them, this is AI-generated. What do you think? They will start thinking what is actually there and critique thinking. They'll enjoy it also. Don't ask them to create a plan. Don't ask them questions. What are the 10 causes of this? That's all questions which are old now. Then assessing human skills that AI cannot replace. Our assessment should now look for professionalism, empathy, leadership, and workplace-based assessment becomes more important today. Today, I think WPAA is something which should really introduce in our country and shift from assessment of learning to assessment for learning. We have to completely change our assessment. We have to move towards continuous assessment, reflective practice, programmatic assessment. Assessment becomes a tool for improvement rather than merely certification, and increase the authentic assessment. So you normally bring these portfolios, longitudinal portfolios. I think because now there is something called as a complex problems design thinking. This is something we should understand. Today we get patients and problems which are more complex. There are ethical problems, there are issues, there are economic issues. And then I have to still treat it in a low resource setting with the guidelines of West. How can I do it? These are complexities. How do my students stand to that? This is what we have to teach our students and assess them. And this is what we need to do now in a real clinical scenarios. How universities should change. Universities need to redesign written examinations. Open book examinations, I'm okay with this. Open AI examinations, I call them. Let students write papers with AI. It's a little radical thought. Many universities have started doing it. Our universities take 20 years to really come to that. But what will happen? Students will know this is available to me, how I'm going to decide based on that. And case-based assessments, AI-assisted examinations, strengthen programmatic assessment. Today, Tejinder and everybody talks about programmatic assessment. Actually, it has to come. Many universities, even in India, have started programmatic assessment. Out at schools and also anyway started. Engineering has started. IIT was there in any way there. We in medicine were expecting summative single stop examination. Now we have to change ourselves to programmatic assessment. So in your own institution, discuss strategies to integrate AI in assessment response. Talk with your HODs. What can be changed in formative assessment? How we can include all this? The faculty development is a big thing. First there is a faculty mind change. Faculty development. You have to train your faculty to use it well. Train your students well. But same thing you have to do. I remember when open surgery shifted to laparoscopic surgery, we had to go through this whole exercise.
And today everybody does laparoscopy. Now laparoscopy is changing to robotic. The things are going to change. We have to do this process of redesigning. Policy framework for AI in exams. Many universities today have policies for use of AI. University of Copenhagen, University of even Vellore. I gave a talk in Vellore about recently. They have now policy for AI use for students. As soon as student enters the college, they are given policy. And balancing AI use with human judgment. So effective integration of AI generated content is very important at continuous expert review. So the future is from memory testing to wisdom testing or complex testing. We have to change. The old question was, what does student know? The current question should be, can the student apply knowledge appropriately? Ask him a different question. Can the student work safely and efficiently, effectively with AI while maintaining the sound clinical judgment, professionalism, and patient-centered care in an ethical way? This should be your future question. And this is what we need to really work. I just want to keep you thinking with summary on this. So summary, I would like to say, shift from recall to reasoning, assess AI literacy and critical appraisal, emphasize communication, professionalism, and empathy, increase workplace assessment and authentic assessments, adopt programmatic assessment, use AI to enhance assessment design and feedback. The goal is not to assess what AI knows, but what the future doctor can do with AI-assisted knowledge. We have to see AI as a tool, how I can do it. That's what I want to assess, and that is where the whole thing should be there. So AI cannot replace medical educators. It will augment their ability to assess learners more objectively, continuously, and meaningfully. I think that should be the tagline. So the question is, you have to really make a change into your thought process and whole thing. We should use AI as a tool to improve your assessment rather than getting fear of AI. Thank you so much. Any questions I can take? Anybody has any questions, comments? Swapnil?
I read a lot about from Harder that Harder gives us their feedback, active learning, individualization, and making learners relevant. And now individualization is within our grasp, and that work is still very difficult at that time. And secondly, I wanted to ask this comment. But secondly, I wanted to ask that we have these logbooks and students share the answers in the WhatsApp and they write the same thing to begin. Everything is the same manner. If we tell them to draw flowchart, also they will get it from AI. Should we use more of Viva also now?
Use portfolios. Logbook many times are manufactured and they are manufactured and wrongly prepared. Many times I feel sometimes that logbook when we create is such a waste of energy of people. Many times so ragging. Many times you'll find the seniors will ask junior to write his whole logbook. I think the time has come, we should stop all this. We should use portfolios. There should be a critical review of a logbook and try to take, it has to be done truthfully. Unfortunately, we are not doing it. It's a load. I don't blame any teachers. This is where this AI-based assessment is going to be of great value. AI can easily detect whether this is created by AI or this is his original thought. And then you can really improve on it, give a feedback to him. Portfolios do it better. So many of the countries have shifted to portfolios. Indian experience of portfolio is good. Many institutions have shifted to portfolios, which the students also feel it's much better. We are a little slow in this, adopting this, but logbook is not a good answer. The way we do logbook is not a good answer. Logbook is a good concept, but the way we do it is not. Any other? Yes?
Basically, we promote the AI. There can be artificial bias also.
Yes. Therefore, you have to have a human oversight.
And second, mismatch AI is still faculties versus student. That's the answer of it.
See, this always happens I always feel there are 3 levels of people. Like I used to say, when now robotic has come or laparoscopy has come. I used to always say there are three levels. Those who are above 65 or 70 or 55, they'll say, मेरे काम का नहीं है, ये 5 साल के बाद है, तब तक मैं retire हो जाऊँ. So you're not bothered about that group of teachers. The younger people who are going to be faculty, they are anyway proficient in AI. They are going to use AI anyway. The problem is of middle-aged faculty. Now the problem is they don't want to change. So this is where you find variability in the faculty skills. There are some people who are very good in your own college. Look around. There are some people who are very good in AI. Some people even don't know how to use mobile properly. So we have a variability. Now the question is, we need to have faculty regular training in this if you want to bring the uniformity. You understand? This is a major problem in a country like ours when it is changing. But look at the examples in India. UPI is one of the best examples. How people started using Google Pay or UPI, every corner you find a dhobi wala, a vegetable vendor uses this Google Pay. And that digital literacy has gone so much. Telephones have changed so much. So I think it's the way we invest into all this. Yes, Praveen, you have any questions?
The body also need to see.
You are the regulator. You can change everything if you want.
Some enforcement now needs to come from NSC also. I mean, everywhere in BCME, ACME, other courses also. Because people usually don't get themselves trained in AI.
Recently, I think National Board conducted a very nice 20-session course on AI in clinical practice. I think it was one exceptional course, good course. They had got all international faculty. They talked about data, utility and all. I think such courses should be done by an MC online. There's no investment much, minimal investment. But if you do and make people do these courses compulsory about using AI literacy, I think that is going to take us in a different way.
Yes, sir. I see.
Sure.
Thank you so much.
Sure. I think it's okay. Thank you. Thank you.
So
We can't hear you, ma'am.
That frustration leads to some kind of a conceptualization. आपके मन में ही होता है कि ये शायद this is what they are thinking. You are conceptualizing the idea. Because you have conceptualized something within yourself, you start making changes in your behavior. Because you have thought like that. You have conceptualized that idea. And because of that change in your behavior, there is a certain outcome that takes place. That outcome can lead to a tornado, and they say that, it could change from cooperation to competitiveness, etc. And finally, when it just cannot be met or cannot be resolved, we will reach to a stage where hurt before being hurt or mutual self-destruction. It can reach to that kind of a level. That is the situation that a conflict can lead to. And all of us at some time or the other in our careers have seen a risk for workplace violences. So often haven't we seen this in the emergency and everywhere else, that conflict, if not resolved, can also lead to violence. There are many strategies for preventing conflict, emphasizing organization with goals and effectiveness, providing stable, well-structured tasks, facilitating intergroup communication, and of course, avoiding this win-lose situation. ये होगा तो मैं win करूँगी, ये होगा तो आप lose करोगे, and that kind of a situation will never leave people happy or satisfied. However, there are some strategies which will never work. First is non-action. चुप बैठो ना, समझ में आया है लेकिन दुश्मन बोले जाने तो छोड़ दो. एडमिनिस्ट्रेटिव ऑर्बिटिंग, हाँ 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 देख लेंगे, कल आ जा कल जा कल आ जा, कल आता है आदमी, कल नहीं, अरे परसों परसों परसों, आज तो मैं बहुत बिजी हूँ. This is called administrative orbiting. Due process non-action, the whole process only is non-action. Then there is secrecy. Oh my God, this is what happened. Just don't tell this to anyone, just keep quiet. Or character assassination. वो आदमी ना, ये वो तो ऐसा ही है. I know that person since years. 30 साल में नहीं बदला, अभी क्या बदलेगा? You're not looking at the act. What are you doing? You're looking at the person. And then demeaning that person so that things can never go right. So of course, I won't describe this slide completely, but remember that to any conflict there are personal aspects, how I am built, there are situational aspects, and of course, there are aspects by which you are bound, that is organizational aspects. Quickly, if you have the time, do we have the time or should I just avoid this? You can yourself find out your conflict style, managing conflict style. Okay? When a disagreement arises, what do you usually do? There are 5 ways. Read it and you decide what you do. Don't tell me. You can make a note somewhere on your mobile to say what you do. Okay? When time is limited, I tend to take control and decide, quickly involve others for input, find a workable middle ground, delay the discussion, or let others decide. See, all of us are made like this. No? We do one thing or the other. When the relationship matters a lot, you have a friend who's very dear to you, but you realize that this conflict is going to really spoil the friendship. What is it that you will do? Still stand on my ground? Work together to solve the issue? Adjust expectations on both sides? Step back to avoid tension? Or just give in to maintain harmony? What kind of a person are you? Think. When I strongly feel about an issue, I argue my point firmly, I explore all perspectives, I negotiate, I withdraw, I lead. So depending on all this, we can say that, if you have more A's, you are more competing. If you have more B's, you are collaborating. If you have more C's, you are compromising. If you are more D's, you are avoiding. And if you have more E's, you are accommodating. So let us see this. There is this Thomas Kilmann diagnostic compass, which talks about all these parts. And you have the competing, where only one can win. And it had better be me. ऐसा सोचते हैं कोई लोग. Some people will say, avoid. I don't have to explain what avoid is. Collaborating is, I reckon we can both get this done. Let us do it together. Accommodating is, okay, just do it your way. Chodo na, kar lo. Compromising is, can we just meet in the middle and solve this ourselves? So look at this one scenario. The university has approved a new competency-based assessment system after 2 years of planning. Several senior faculty members refuse to implement it and continue using older assessment methods. As Dean, Dr. Chinmay Shah, you discover that students are being assessed inconsistently across departments. What is this nature of conflict, first of all? What is the nature of conflict? Okay. So, if someone is not ready to put things into action, how will you apply a competing conflict handling, and why will you use another method? Or what? Just tell me what approach would you use for this kind of a situation? Would you avoid? No, okay. No, but what approach would you use? Collaborative chalega. Ideally, according to me, you would compete, because this is something regarding putting things into action which are put down by NMC. So you should say that you have to do it my way. NMC has laid down the rules. When we send them our question papers, NMC is going to say, "Ye kya hai? Old methods that you are using. Where is all the teaching that is happening?" So you will have to put your foot down and say nothing good. So you will use a competing thing by saying that I am boss. Ideally. So that's what we should. Yes, blanket order. Look at the second scenario. Two faculty members are designing a new teaching model. One prefers traditional lectures, the other wants fully interactive flipped classroom. The discussion is stuck. आगे बढ़ ही नहीं रहा है. What kind of will you use a collaborative kind of a handling situation, or will you not use? कि थोड़ा तुम्हारा भी सुनेंगे, थोड़ा हमारा भी सुनेंगे. Let us go ahead. Scene 3. Two departments request the same auditorium for important events. I've just picked up these issues which I have seen throughout my career. Two departments request the same auditorium for important events on the same day. Both have valid reasons and external participants coming. Yehi hall chahiye sabko. So what will you do? You will accommodating by saying कि next time मेरा function होगा तो मैं पहले I will be the one who will take charge. Yes? Change the timing. So that is accommodating. So, fourth, two senior colleagues frequently disagree during meetings, and conversations always become very tense. Today, the disagreement is getting personal in a group setting. In front of everyone else, they are calling each other names. Tell us. What will be the approach? Ideally, in that, because you cannot also in the group, no, you cannot speak up to insult those two seniors. So for the time being, you will avoid, but when the going is good, you will call them and say, "Kya tamasha hai?" Yes? That is what you will do, right? The last one. A junior postdoctoral fellow strongly advocates publishing preliminary findings quickly. You believe waiting for additional validation would strengthen the paper. However, the fellow needs publication for a fellowship application deadline. What would you do? You would, yes, you could be accommodating, but I could also say, find out from the rules कि उसको conference में paper पढ़ लिया तो चल जाएगा. It can be counted. वो भी देख सकते हैं. So instead of putting up all that data and publishing it half-heartedly, you can see whether he can be sent to submit that abstract somewhere, and maybe. So you can accommodate that way. Teri bhi chali, meri bhi chali. That kind of a situation. So this is a matrix that all of us can think of, and remember that there are a lot of emotional side to it also. And remember that there is also could be a risk that is involved. And for all that, communication is very, very important. Okay? There are causes of conflict, non-verbal communication, unclear expectations, poor listening skills. There could be cultural differences also. You know, what happens and I'm okay with in Mumbai may not be all right in Bhavnagar. You know, which we should also appreciate and accept. So the bridge is to minimize the conflict by recognizing and addressing the non-verbal cues, by facilitating mediated discussions and encouraging open, honest feedback. So please remember that from frustration to destructive behavior, if you want to avoid that, there are a lot of things that you have to do, including active listening, focus on the issue and not the person, the I statements over you all the time. You do this. You are like this. Change. All right? And schedule regular feedback. So in every interaction, remember, you have two choices. To win the argument or strengthen the relationship. So always when something like this happens, choose wisely. There's this very nice quote that I found which I put there. I needed to replace the joy of being proven right with the joy of learning what's true. So listen before you lead, clarify before you conclude, focus on shared goals and not individual victories, and use interpersonal communication as your ultimate leadership tool. I don't know whether I'll be able to play this video. It's quite a nice one. Chal rahe it doesn't matter. I just end because of shortage of time. Huh? Yeah, I'll send the video on the group. Butterflies struggle most just before they emerge. And that was also what Supesh has showed us when he finished his talk. And remember, when I'm very fond of these cartoons, Tiny Dragon and Big Panda. So, Big Panda, Tiny Dragon told Big Panda, they're sitting in that hole, I can't find my way out of this hole, said Tiny Dragon. Big Panda smiled and said, then I will come down and sit with you. So if there's anyone in trouble, if there's anyone finding any problem, go there and just sit with that person. And I'm sure things will work out. Thank you so much.
Thank you very much, ma'am, for sharing your valuable insights. Now, I will request Dr. Panjwani sir to felicitate Dr. Sucheta Bedi ma'am. Now, we would like to invite Dr. Chinmay Shah sir for highlighting use of e-law book for PG students. Please welcome sir.
Good afternoon. So now we will have, I think this is the last lecture. After this, we will have a few videos of logo management competition, and we are targeted to 3 by 4. So don't worry. I can understand that it is a long day. In morning we have a workshop, and then today Sunday also. So basically, now gradually we are moving in CDME, not only in medical but dental, physiotherapy, homeopathy, thyroid, nursing everywhere. And I'm just going to share a few slides on what is e-book, and I have a slide from our own Dr. Vijay Mahajan regarding e-book and portfolio. So we'll share that, and
observed as required by some of the institutions.
and then procedure. Number means एक हफ्ते में कितनी बार किया, 2 बार किया, 3 बार किया, because NMC said that the student has to do the logbook entry once a week, and so once a week whatever time you have to do. So here date you have to mark. You can write the details of activity that what I have conducted. Similarly, see, we have tried. This is not compulsory. That if you want to convert your logbook into portfolio, we have to upload the evidence. For example, I have presented lecture today, so I can upload my photograph. That I have presented a lecture, I can upload my PDF and everything. Then have I received the feedback or not? Yes or no? And one more thing, that who will assign my entry? So if college decides that PG teacher will guide, then his name, and if they will not select, anybody can ultimately check my assignment, and ultimately I will write the reflection. So by doing these two entries, the log is converted into portfolio. So this is any very brief I have said. Similarly, once we do the entry, a faculty will be able to see what entry has been done and what not. If you just want to check what has been done till today, he can just select here and just click on the view button. So all the entry which has been done can be seen here, can be downloaded in PDF, can be downloaded in the Excel. And similarly, I can have a score, summary and print. So I know the time is very short. So this is in short how we are doing. Any questions? I know it is very short and very crisp. Okay, so if you want more detail, we can discuss for an hour or 2 hours regarding the same. But due to paucity of time, we are resting it here. Thank you very much. And I know, and I'm happy that right now I'm presenting in front of Supesar, the e-logbook module where has been designed under the guidance of Supesar, and it is based on our NMC logbook guideline. We have created this. So thank you very much, sir. And we are very happy that you are here when we are presenting our innovation. Thank you.
So we have an app for this, please.
Yes.
So we have an app which can help for all these things.
Yes, for Android app is available. iOS is not available because it will become too costly.
Okay, okay, sir. Thank you, sir.
We would also like to take this opportunity. I humbly request Supesh sir to felicitate our developer, Urvish Mulani, who has developed this whole learning management system for us. Yes, sir.
Very good thing. How many colleges do you use today? 55. Become 5 now.
Thank you, sir. Thank you, Urvish bhai, for your constant help.
Good afternoon, everyone. I am Urvish Mulani, founder and CEO of Azip Tech company. It is a matter of immense pride for us that the journey in medical education technology began with Government Medical College Bhavnagar. Our first client and trusted partner for the past 6 years, we have had privilege of developing, continuously supporting the eGMCB portal and the learning management system, contributing to the institution's digital transformation journey. Today, our NMC compliant solution, MediLogbook and MCourse LMS are trusted by 55 medical colleges across India, helping institutions strengthen competency-based medical education and accelerated digital transformation. I sincerely thank respected Dr. Chinmay Shah, Dean of Government Medical College Bhavnagar, and the entire team for giving us opportunity to be a part of prestigious workshop to support medical colleges in embracing digital learning and academic excellence. We are delighted to announce an exclusive offer for the participating Medical College of Bhavnagar, Gujarat, a complimentary 3 months of free trial of MCourse LMS, including implementation support and faculty orientation with no obligation. We look forward to partnering with more institutions and contributing to the future of medical education in Gujarat and across India. Thank you so much.
Thank you, sir. I would request Dr. Bhanani sir to felicitate Dr. Jigmesh Yadav. Now, we would like to welcome Dr. Harsh Mehta sir, Assistant Professor, NSSA Department, for our next session on sharing best practices and low-cost managing winners announcement. Please welcome, sir.
Dr. Harsh said, you organize so free. So you try to organize COVID to all over India and three category faculty. So we also have participants joined online, and we have three judges from our college: Dr. Lopa Mehta, from KEM our Dr. Praveen sir, and from KLE the in charge of our Dr. Gumte sir. So three were the judges, and for faculty there was 1, 2, 3 number, for PG 1, 2, 3 number, and UG 1 and 2 number. So we are just going to showcase first ranker here, and we will also share a link of all the innovations on Google page which we have already uploaded. So I request Dr. Harsh. So Harsh, I am thankful to Dr. Harsh. He has coordinated all the event, and I am also thankful to all the three judges who has given the time, and we could able to rank them, and we are going to have a prize money for all the winners. Thank you.
Good afternoon. Thank you, sir, for explaining and reducing my task here. We organized this event in the month of March to April this year. And if any medical education and is increasing, students are increasing, and to give hands-on each and everyone to the patient directly is difficult. So we can have some mannequins which are very costly. So we can have some homemade mannequins with ready available materials so that students can practice at one.
Complications. So, within the three categories, the first consultant category, we received almost 12 entries all over India. At the third place is Dr. Rajesh Bhagwan sir, from Professor at Medical College. He has made a model for Japanese surgery in critical hemodynamics hypertension. At second place is Dr. Nikita Mewada ji. She is from Government Medical College, Bhavnagar. She has made a model on central neuroaxial blockage. And at the first one is Dr. Nekili Hoskale, that is from she's from EMMC, and this is her video. She has made a USC guided FNSC molecule. Education research presenting on a model of association psychology is based value. It can be utilized for the purpose of demonstration and practice as well for the medical competency. So this is the medical for a non-taking competency of the station to mimic the shape of dress and a statement and upper garment and stitch it around the peripherals and a
colored cloth, laying above borders tree, and literally the cloth with pieces of sponge and very flower ones on soaked in red color solution in a balloon. And take two such balloons with lungs near the sponges illuminating lungs. One lung can be cultivated, which is not attached to the base, while the other lung is fixed to the base, so one has to shift to the base front, and it cannot be cultivated. I have placed this all in a control box used for packaging. I'm demonstrating now as an MC for the superficial lung. Cultivate the swelling and then inject the thymic aspiration cytology needle inside the lung. After inserting the needle, I will aspirate and I am getting a red colored fluid, which is symbolic of human tissue. And now I remove the needle. The second lung is not culpable. Makes Yoshi guidance by penetrating the needle inside. So I will advance the needle in this suspected area and simultaneously I am doing USG. I am holding USG probe in one hand and remove the other. By inserting the needle, I am pulling it back also to produce some back and forth motion so that I can see the needle movement in the USG and I can confirm from the USG that the primary aspiration cytology needle inside the text lung. Once I confirm, I will draw the fluid into the syringe for testing in lab. I now remove the needle. The advantage of this mannequin is that it can be maintained easily. You can refill it with new sponge from the top side, which is not stitched. I can replace the sponges from this opening only. The sponges are easy to refill. I can inject it directly into the lung and even without taking it out. I'm using mobile charging cable to disassemble a USB wire and probe, which is attached to the laptop. I'm showing a video of USB wire dependency while doing the procedure. So a demonstration can be given this visual for showing how to perform USB wire dependency and in which conditions where it is recommended. Students can get experience about examination of lung in the breast, which can be culpable or fixed to the base. So this sample is made out of very easily available and cheap materials. It is reusable model, can be used multiple times. Some improvement could have been done, so we can embed sensors near or inside the lung, which will automatically give signals to the mobile phone. This kind of video of me inserted into the lung and the mechanism procedure. When needle touches the sensors, video will be displayed. Due to some time constraints, I do not make it. It's easy to make and easy to maintain and easy to refill by making at the same time helping efficiently for demo and practice and study for the safe competency.
I request Dr. Medically, if you are over there, please. In the PG category, we had the third place was Dr. Rajveer Bhimani and team. They had made a model for intubation using direct laryngoscopy and using a video laryngoscope. At the second place, we had Dr. Gyananda Chowdhury from Government Medical College, Bhavnagar. At the second place, we have Dr. Gyananda Chowdhury. She is from SMBT in Pune, Maharashtra. She has made an umbilical vein cannulation model. And at first place, we have Dr. Dhruv Dhamian team from Government Medical College, Bhavnagar. They have made a model for subclavian central venous cannulation. And yeah, why such an is starting method and the procedure is shown. So they have did this by step. That first they have located the vein, then inserted the guide wire, and by the centimeter technique, roll over the dilator, and then the central vein was introduced, and now they are checking for the backflow if it is in the vein. If it is in the lung, they would not be having backflow of blood. And the most common complication of this is pneumothorax. So they have kept a lung behind it. So if you have wrongly punctured it, you will burst the balloon, which will detect that you have caused a pneumothorax. So that is the wrong way to do it. And we also received 2 entries in undergraduate categories also. In that, one we received from Kodaka, Andhra Pradesh, and the winner is Utsav Dave. He is a third MBBS student from Government Medical College, Bhavnagar. He has made a model on IV cannulation in vein and blood sampling. Is Odisha or Dr. Who, are you available online? Very difficult for them to judge also because all the mannequins that we have received were excellent and they have worked very effortfully for making all these mannequins. We've also created a web page to display all these mannequins work. We'll share the QR code of the website also so everybody can see it. And all the mannequins can be used for further medical education and training wherever we want.
I think at the outset, let me really congratulate everyone. Such a wonderful work I think they have done. It takes time for people to create something and think about this in this such a setting. And most importantly is what they have used is a very low resource, very useful. And I think if they can really develop this and make it available to everyone, I think that's the way the usefulness will really increase. It's wonderful to have an idea, Chinmay, to have this competition. And I'm sure, I think this should be a routine for many of the AHP conferences, and we should try to develop our own repertory of new resource management. It always has been there. Thank you so much, wonderful idea. All my, I think I must really thank all the contributors who really took part in this competition because itself is a creativity. And of course, all the best to the winners and their future. Thank you so much.
So she is the PG winners who has the sub-level and sub-level education. So great, congratulations. Thank you everyone. I think we are coming to the end of the session. Tea is waiting, and I thank all of you who are staying till end. We are also going to send one more feedback form, and it is a certificate module. So now those who will fill the PDF form of the FDP, we get one more certificate of the conference. So, Abhi, yes. And lastly, I would like to welcome all of you to become a member of Association of Health Professional Educators. And lastly, we will have group photo. So now 3 tasks are remaining. One is feedback form, post test, and group photo. So we will be sharing the link of AHP group. So Association of Health Professional Educators, as name itself suggests, it is a group of all health professional educators, not only medical. So we will be sharing the details of link. So there will be monthly dialogue. There are different lectures which are happening every month. We will also have a workshop, and there are wonderful conference. This time the conference is at Bangalore, NCHP 2026. It is Ramaya Medical College, Bangalore. So we welcome all of you. You can have post a CM. So this is a post-test CME for questionnaire, and feedback we will put in the group. So those who completed, कोई चार्ज नहीं है नहीं बात ओके so बताने feedback form and post-test questionnaire भरेंगे कि we will have one group photo and then we will post-test. So first we will can have a group photo. All of you please come here. Let's have a group photo. પછી post-test ને feedback તમે ચાર બી ટાઈપ ભરી શકો. અહીંયા ASP નો પાછળ બેકગ્રાઉન્ડ આવી બધા આવી જાઓ.